All right, everyone. It is Tuesday, January 12th, 2021. Welcome to this work session and special called session of the Athens-Clarke County Mayor and Commission. We have a number of items to get to tonight, but among the things we need to do is feature a roll call, since we do have a special called session, so that we can ensure that we have a quorum, and then enter into executive session formally, which will actually follow a couple of work session components. So, Madam Clerk, if you're on the call, you could go ahead and call roll for us.
Davenport.
Here.
Parker.
Here.
Blake.
Here.
Wright.
Present.
Denson.
Here.
Poole.
Present.
Edwards.
Here.
Myers.
Here.
Thornton.
Here.
Hamby.
Here.
We have a quorum.
All right. I would entertain a motion to enter into executive session for the purpose of litigation later in this evening.
So moved.
Second.
All right. I believe I've got a motion from Commissioner Parker and a second from Commissioner Edwards. All in favor?
Aye.
Aye. Aye.
All right. All right. All in favor of adjourning upon conclusion of that executive session. Do I hear a motion?
So moved.
Second.
All right. I've got a motion from Commissioner Edwards and a second from Commissioner Parker. All in favor?
Aye.
Aye.
All right. Thanks, everyone. All right. So we will get to that executive session. So for members of the public who are viewing, we'll have a public session, and then we'll go into executive session for a period of time, and then come back into public session for the remainder of our agenda.
And Mr. Mayor, just to clarify for everyone, I know it's on the agenda, but for the public, the executive session is for the purpose of discussing pending litigation.
Yes, that's correct. Thank you, Attorney Drake. All right. We are having a recurrent update on our area COVID-19 response. And we are fortunate because with us tonight are, I believe, Whitney Howell, Sarah Peck, Emily Eisenman, and Dr. Stephen Goggins from the Northeast Health District. And so, Manager Williams, is there anything else you want to provide by way of introduction?
No, sir. I appreciate the folks being here with us tonight to help share information.
All right. Dr. Goggins, we really appreciate you and your staff being with us. And thank you for all you're doing. I know this, particularly as we've moved into vaccination, has been an enormous area of community interest. My email box is full of queries. So I'm going to go ahead and turn it over to you and let you walk us and the public through the kind of response situation that we're in right now.
All right. Thank you, Mayor Girtz. And thanks to the commission for a chance to be here again. And you've introduced the team members that are on. I want to show a few things. It has certainly been a real ramp up as we've started vaccination. But I have to say it's a lot more for me, and I can tell for the staff and actually for the folks that we are working with, the clients, it's a lot more exciting. People really do feel the optimism that this is the pathway to end the pandemic. And so even though I can tell you the public health staff, and particularly the folks that are on here, have been working extraordinarily hard, it is definitely been a really motivating and positive experience. So I hope that the screen is showing. I want to say just very briefly, otherwise COVID spread is bad. I don't think I'm telling anybody anything that we don't already know, but the map here of Georgia shows the penetrance from kind of the entire north of the state and then down across our district, including Clarke County, with the highest level of transmission. We're at a level of cases that's well beyond anything we saw in the summer. And so that has been going on now for several weeks. In the last 14 days in Clarke alone, there have been about 1,300 lab positive cases. And by that, I'm adding together our PCRs and our antigen cases, because they do both get the same epidemiology treatment. So things have been very tough. Hospitals are definitely getting the surge, and we're just seeing widespread community transmission. But the good news, and really what I think is what I want to focus on and what everybody wants to hear about, is vaccine. And so I want to say a couple of things about it. One, distribution planning. So Georgia's plan really involves enlisting a wide array of providers into the effort. And right now, the main limitation on that is vaccine supply. So there are 1,400 enrolled sites across the state, and those can be doctors' offices, they can be businesses, they can be their hospitals, of course, and other kinds of clinics. And eventually, when there's enough vaccine, all of those sites will be able to order vaccine and administer them either to their own population or to their folks plus the community. Now, everybody who's in the process will have to stick to the priority groups, but what's going to happen is we're going to get more and more places across the state where people can get vaccines. You have to have enough vaccine to get them all stood up, and that's really what we're looking at right now, in my opinion. But when it's done, there's going to be just a huge geographic and other kind of option set for people to get vaccinated. So right now in Clarke County, there's 23 sites on the list, 38 others around the district, but many of them don't have a lot of vaccine yet. Some have gotten some vaccine for their own internal, say, healthcare population. But that is the main thing on those. I think this is a great model because, I've looked at some other states that have gotten ahead of us maybe on early vaccine, and they've set up major, centralized sites, which get started faster, but I don't think it scales well. And this, I think, is going to be much more flexible, and it's going to handle the subsequent phases better. So, of course, we don't have enough vaccine that everyone who would want it can get it. So we're working with our priority groups. And right now we are in phase 1A. And it's an expanded version of 1A that now includes, in addition to healthcare personnel and long-term care facility residents and staff, all first responders, medical and non-medical, and folks who are 65 years old and older. The next phase would be the 1B, which includes mostly, as it stands now, critical workforce folks, and then as the plan holds, 1C would be people with underlying medical conditions that are in these younger ages. So since 1A was expanded, we've got a lot more 1A to go. Don't have a great timeline because it does depend on the ability to get vaccine and to get sites going. But I can tell you what we've done here so far. I'm just incredibly proud of the work that's been done here. But we've got right now, primarily out of the Clarke Health Department, we've done about 3,200 vaccines. And we've been using mostly Pfizer vaccine. This is a daily run since the very beginning. And here at this point, we're doing 200 to 250. It's going to go up a bit more than that as we start to get second doses in. But that's just at the one site, the Clarke Health Department site. We have another site coming, which I will tell you about. And I have to mention that pharmacies are covering most of our long-term care facilities. So the federal pharmacy partnership you've heard about, almost every nursing home and assisted living facility in the district signed up for that. That's moved a bit slower than we had all hoped, but it is happening. We're keeping in touch with those facilities, and they're getting scheduled, and so they're going to get vaccinated by one of those federal partnership pharmacies. Now, the site that we have, even though it's at the Clarke Health Department, we are serving people around the district. But of course, the majority of the folks that we've done have been Clarke County residents. But we have gotten some people from other counties. But because we know we need to ramp up our volume, we're opening a drive-through site as well. And we're going to continue running out of the health department. So everything we're doing now, we're just adding to it. And then also, that started this week. And next week, the counties outside of Clarke are going to be doing their own health department-based, generally, sites. And so I think we're going to be in a place to do 4,000 vaccines a week or something like that. We are doing some targeted outreach. There's some personal care homes. These are much smaller entities that weren't necessarily eligible for the federal program. So we're specifically calling and trying to schedule them for vaccine. We have a first responders day for any first responders that haven't been served so far. And we've also asked all our school systems for any of their teachers that are 65 years old or older. So they would qualify that way. Teachers will be in 1B, but these folks would be eligible now because of age. And right now we're dealing with systems as we try to get the kind of call volume and web request volume that came with the 65 population managed. That's probably our biggest area that we're trying to improve in. So then what's coming up? These are things I think are coming up. I think you're going to see major growth in vaccine availability and the number of sites, and those things go hand in hand. And so I see this as like an exponential growth in number of vaccines administered. As we move to the next phases, that's going to be based on how well or how fast we're able to do the prior phases. So, the first thing here, the vaccine availability, then the sites, that allows us to move to next phases, and they grow in size too. I think we're going to see less vaccine hesitancy over time. There's incredible demand right now. There's some vaccine hesitancy, but much of it, as I see, is people who just they want to watch a little bit. And what I've seen happen is in an agency, for instance, a few people will get vaccinated, and then, a week or two later, all of a sudden now we have more people wanting to come get vaccinated. Yeah, so I really think we're going to see more interest as time goes on, and it won't take that long. It looks like there's going to be a change in policy around whether the federal government's going to hold back vaccine for second doses, and I think they're now telling us they're going to release that. So that may mean more vaccine early. And of course, we're still learning stuff. There's still studies going on, and I think we will learn, and this will be medium term. Is it okay to use two different brands, for instance? Things like that are practical questions we don't have great answers to right now, but we will learn those things quickly, I think. So that's all that I had specifically. I thought y'all might have questions, but I can ask the group too if they had anybody on the team want to share anything.
Dr. Goggins, there were a couple of questions in the chat, as long as we're talking specifically about vaccinations and testing. And I know that, particularly in the early days and maybe even continuing to some degree, there had been some challenges with the website and the web enrollment portal. Could you talk in a little bit more detail about how that's evolved? I mean, certainly I think we've heard all from constituents, who, visited the webpage and wondered, is my request showing up in line in sequence? So if you could talk a little bit about that, that'd be great.
Sure. So this is specific to vaccination. I think that's really where the issue has been, and it's really a matter of volume. The one thing I would say is that we're waiting on. There is a state online self-scheduler that they have been working on and is being tested. It's supposed to be tested this week in some pilot districts, and so we're anticipating getting it by the end of the month. So that is really going to be. We're trying to hold out until that. But the folks when they do a registration, it is getting through, and we are reaching out to them with a large group of people as fast as we can reach out to them. We're scheduled out quite a ways through doing that. I would like to get a notification just that they're still in the queue. I think that would be helpful just to let people know, because they do worry. And so we are also trying to get that done. But the answer to this is about 2 weeks away. 3 weeks away, I would hope, with this electronic self-scheduler.
Okay, thanks for that. And then, as we've pivoted to vaccinations from public health, can you talk a little bit about continued efforts with testing that are happening concurrently?
Sure. I mean, we are still doing testing. We have moved some of our emphasis onto vaccination. So testing is still available. But of course, there's lots of community resources for testing as well, and we put something on our website to help people find testing sites. There are a lot around the community now.
Okay. We've got a question about the efficacy of the vaccine if a patient is infected between doses. So if they've received their first dose but not their second, they're either exposed or infected. Can you talk a little bit about the dynamics there?
Right. Well, that's a great question, and we're seeing that, and they saw that in the trials. I mean, when you have widespread transmission, then you're going to have those kinds of things occur. The guidance says, and since it was in the trials, we kind of know this works okay. The guidance says that if you do become infected, either you're infected before the first dose, or you become infected after the first dose before the second. You will finish out the sequence, but just make sure that you've gotten through your isolation period and that you've recovered, so you're not still feeling ill. That's just general. We try not to vaccinate people when they're sick. Ever. So that's just not, it's typical. But so if you're well, then you can go ahead and have your second dose. There's no reason to think it would make it any less effective at all. I think if anything, it might act as an extra booster. But we do know that the vaccine with the first dose plus the booster is about 95% effective.
All right. There's a question about hospital capacity. Of course, I think many of us and many members of the public are looking at things like ICU bed capacity, and we know we've been over 100% capacity for Region E here, the hospital district, many times in the last several weeks. Can you talk a little bit about kind of mitigation efforts there and any other measures that you would recommend to control community spread?
Right. Well, the hospitals are definitely seeing the results of the surge, that's for sure. As far as their internal, which is most of it, I think those are going to be questions that they can answer a lot better, because there's many, many things that I know all the hospitals are doing to maximize their ability to take care of everyone that they need to. Of course, the thing that we need to do is get back to the basic measures. I mean, the thing that's going to stop this wave of community transmission is still avoiding gatherings and mask wearing and distancing, physical distancing. The vaccine is going to help. It is the right thing, but it will take more time to get widespread enough than we really want to wait. For this wave, we need to be doing all the basic stuff. I will say that by targeting the 65-year-old population and the healthcare workers, we're doing two good things. The folks 65 and over are the ones most likely to be admitted to the hospital if they get sick, the ones most likely to need ICU care. So the more of them we can vaccinate, the better, particularly from long-term care facilities. And if we can vaccinate healthcare staff, that's one of the big challenges of the hospitals is getting enough workers, because many of their workers get sick. So if we can vaccinate their staff and protect them, that gives them more capacity.
Mm-hmm. So, given that rollout is in these phases, how do people demonstrate their employment or age to qualify for each one of those phases?
So, for age, we have, in many cases, we get some sort of documentation of age. Employment, we have been asking for work email, or work ID, things along those lines. I mean, we're trying to be as flexible as possible. And I will say specifically that people do not need any sort of documentation requirements to get vaccinated. We vaccinate everyone who is eligible.
Okay. When somebody makes the first appointment, they receive the first vaccination, are they automatically in the queue then for the second one, or do they have to make a separate arrangement for that?
We actually give them the appointment on the way out. So they leave the first vaccine with an appointment for the second vaccine.
Okay. Commissioner Myers asks about the opportunity for vaccine equity, given that one of the primary portals is a web access portal. What's being done to make sure that those without technology are able to get the vaccine and be aware of its availability?
So we also have a call center, so we can do all these functions over the telephone. So that's the main way that if somebody didn't have access to the internet now, or for when we have a web scheduler, that people would get scheduled. For testing, once we had better online scheduling, then the call center was much more functional. When you have right now this much volume trying to get in both ways, the call center has, to be honest, it has waits. But once we have the web scheduling, that takes care of so much of the volume, then the call center becomes a much more easily accessed and functional method to get scheduled for those folks who don't have internet access.
So because that web scheduler will then just be automatic, you'll have some staff more available for the call access. Okay.
Yes.
Can you talk a little bit about the nature of the 23 agencies you mentioned that were approved for vaccine distribution? Are some of those private health clinics? What's the nature of the range of those?
There are, I don't have that document open, but I know from recently looking at it, it's our hospitals, of course, and health departments. And then also there are some clinics and there are pharmacies on there as well. There may be some other types of entities, but those would gather the bulk of the types of places.
Is that something that you could send to us?
It's actually on the state website, but yes, okay. I can. There's a link to the spreadsheet that is kind of below the vaccine locator, actually, that they've just added.
All right, perfect. I'll find that and make sure that everybody on the commission gets that. Just a couple more questions. Do we have something that spells out phasing beyond the one phases and any kind of rough estimate as when we'll move into 2 and 3?
So the ACIP, the Advisory Committee on Immunization Practice, that's from CDC, that all this is based on. I mean, Georgia makes its own guidance on this, but it is very closely follows the ACIP guidance. And the way the ACIP guidance works is it's 1A, 1B, 1C, and phase 2 is general population. So if that doesn't change and if Georgia continues to follow it, it would be just the 3 that I showed you a graphic of, and after that it would be essentially everyone. As far as times, that is so dependent on the vaccine availability. I think it is hard to make good estimates of it. I mean, we've heard estimates of how long it would take generally, and I think that's probably reasonable. But specific phase to phase is really tough.
All right, yeah, and I heard you mention that you imagine that in several weeks' time we'll be at the point where there will be 4,000 vaccinations a day, and I guess you mean for the region. Just Clarke.
Just us, right? There's going to be 10 times that once there's other providers on. 4,000 a week was our goal.
Oh, I'm sorry, 4,000 a week in Clarke County.
In Clarke County,
Okay, all right. Thanks. Yes. That's helpful. And then Commissioner Link asks about social workers qualifying as 1A. Do you know if that's the case? Are they considered frontline providers, people who do social work casework?
We'll want to look that up a little bit. My thought on that, just without looking it up, is it may have something to do with the kind of, if they're working for a hospital, doing social work in a hospital, they are eligible. At most clinics, that would be true. It may have to do more with the kind of setting in which they work than the credential. That's the way I think would make the most sense.
Okay.
So if they're seeing patients somewhere, they would be eligible in 1A, most likely.
That's helpful. So last question, or a couple more questions. So regarding the web portal again, does everybody who currently registers in the web portal receive a confirmation either via text message or email?
My understanding is they get an immediate, we've received your submission, but I don't think they get a subsequent one, and that's what we're working on.
Okay. So that's sort of in the 2.0. And then a question, when will teachers, I guess K-12 teachers, be vaccinated?
So teachers in general are going to be 1B. But like I mentioned, we've asked all the school systems to try to identify the folks there that are 65 and over, so we can go ahead and vaccinate them now.
Okay. And you mentioned that there's going to be this upgraded web portal, kind of automatic registration. Concurrent with that, will just the strength of the web portal generally also be upgraded? I know a lot of people have just had it crash or freeze.
Oh yeah, we've talked about that the last couple of days. We actually have a couple of options in front of us for just adding capacity to the website. We will be moving on that just as soon as we can. That's something that needs to be upgraded just to handle volume. So yes, very much working on that. Should not take much longer.
And a commissioner mentioned that she'd received a couple of indications for people who did register online but did not receive that immediate confirmation. So just as a FYI, okay. And I'm not sure what the breakdown kind of in the system would be that would cause that, but just as a couple other commissioners kind of chimed in that said that they'd received the same information. And then last question, Dr. Goggins. So should other healthcare providers be interested in being a vaccination provider, should they get in touch with you or somebody on staff?
We can definitely help with that. That's primarily been in our emergency preparedness team. So Nina Cleveland, who's, I think she's on, I think I saw her, but her team is working on that.
I'm Dr. Goggins. Sorry.
Right. So do you want to say anything about how they can reach somebody and what you would help with?
Absolutely. They can contact anyone in my team. That would be either me or my team member, Elizabeth Wilson. We can send anyone the link to become a provider. We can also provide instruction and help through the process. It is a multi-step process connected both with the state and the CDC, and there's trainings involved because we're dealing with vaccines and the issues with vaccine transport. So, but we do have either one of us that can help folks through the process. So I can post my my email onto the chat box, and that way you can get in touch with me directly.
Great. Thanks, Nina.
Sure.
Dr. Goggins, anything else from you or other members of your team?
Anyone else? So, well, I will just say, I mentioned earlier, but we are very excited about the work. We appreciate all of the help that we've gotten from many partners, but one I'll mention, JW has been great and super to work with. And so I know it's hard to ask constituents to be patient, but things really are growing. And I think that you'll see that the impacts of that really quickly, and just in terms of numbers that are administered and how people are reached. So,
well, that's wonderful work that you and your crew are doing, and I know it's been challenging given the kind of sifting sands and new information that's continually coming along, and technology and staffing needs. We really appreciate the work that you, Dr. Goggins, and everybody else from Public Health and the Health District do. Can't thank you enough. Please be safe out there, everyone.
Okay. Thank you all for all your support, and it's good to see you again, and probably see you soon.
Definitely. We'll see you soon. Thank you.
All right, bye-bye.
Kelly, can I say something real quick about testing?
Yeah, we've got to transition to the executive session, but go ahead quickly.
Yeah, we lost, a significant amount of testing in the community, since we had a mobile unit that was being funded by CARES money that's run out. And quite frankly, if we don't keep up with testing, community spread's going to keep taking off. So there are some funding needs to get that mobile unit back up and running. And I did email everyone a couple, 2-3 hours ago with a spreadsheet on that funding need. So I'm hoping that we can take a close look at that and discuss it and see what we can come up with to assure that those testing needs are being met, especially from that mobile unit, which was going into at-risk communities. Typically those folks aren't getting out to testing centers. So I think it's real important that we consider figuring out how to get that back up and running.
Thanks for that.
And I want to chime in and just say ditto to Commissioner Link. Those were my questions that I submitted. I am concerned, and I was concerned from the beginning that those communities that are traditionally disenfranchised and overlooked, that we focus on. So I put my questions in the chat box, but I do think that we need to make a strong focus on this, Mayor Girtz. I appreciate Dr. Goskin's report, but there's always a community that is left out.
I appreciate those comments, everyone. And I think we all share desire to make sure that, we really thoroughly blanket the community with both testing and vaccination opportunity. So for members of this call and for everyone in the public, we're going to move into executive session. And then in 20 minutes, we're going to come back on with the members of our local legislative delegation to the General Assembly. So Todd down in public information, just let me know when we're off air and we will go ahead. All right, everyone, welcome back to our public work session. We have just exited the first part of our executive session, and following this next segment, we have another brief executive session, and we are fortunate to be joined by Representative Spencer Fry of the Georgia General Assembly. Representative Fry, we're really glad to have you with us. Thanks for coming on tonight.
Absolutely. Mayor Girtz, thanks for having me.
I think we've worked to try and develop the most concise list of requests of you and your colleagues in the General Assembly, probably in my entire tenure with this unified government. I thought we were going to get it all to fit on one hand. And now if you're a fan of the modern classic Princess Bride, you know that there is the six-finger man. So we have just 6 requests of the General Assembly, and I know these have been emailed to you, but for public edification, I'm just going to run down them very briefly, and then ask you if you've got any follow-up questions that might be helpful in determining how to route some of these requests, or if there's anything else you'd like to say at all about the session. Last year, just ahead of the pandemic, we had introduced a request for a low-income homestead exemption, and we're renewing that request and hoping we can get that across the finish line this year. We've asked to clarify the gratuities clause to allow local governments to offer direct assistance to constituents during emergencies such as the pandemic that we're in right now. We've made a request for local regulation of septic tanks so that we can ensure that we're maintaining environmental health throughout our community. We've renewed a request that we'll be able to address speeding in neighborhoods, running radar on lower sightline contours in neighborhoods than we currently can. We've made a request to amend the state elections code to provide that if a deceased candidate receives the most votes in an election, then a special election must be held for that office. And then finally, last item is to allow local governments, and so this would be general legislation, to decide to exempt food item from the local sales tax in the same way that they're exempted from the 4 pennies of state sales tax. So those are our items for members of the public and for you, Representative Fry.
Thank you so much, Mayor Girtz. That does sound like a very concise list, and I can address these one by one, or I can give you all and just make a comment or get any input one by one, and kind of give you start off by giving a little and all of our the viewers what we're doing up here.
If you want to begin with just sort of the general tenor there, obviously we're in a very challenging time right now. I think we've all seen the news reports of security that's around not only the Georgia state capitol, but other state capitals, kind of in the wake of the invasion last week in Washington.
No, that's exactly right. So amid the pandemic and amid an invasion on our nation's capital, certainly the tensions are high up here. We still have a number of folks in the chamber, in the House chamber, that have difficulty wearing their masks. We are split up into 3 different areas. There's 180 members, 90 are seated on the floor. I believe 45 or 50 are up in the gallery, and another 45 or the remainder are in the appropriations room in 341 and working by video. Masks are required by the House members, and we have been required to get tests twice a week. And it's a test developed, I think, by University of Indiana or somewhere, maybe Illinois. And it's the saliva test administered by Georgia Tech. And they seem to have done a really good job with their testing on their campus. And so tests will be administered every Monday and Thursday. And hopefully we can maintain some sort of control over the spread within this facility. Admittedly, yesterday when I came home, I felt extremely unclean. I know some of y'all have been in other crowds and gatherings inside that you may not want to been in, and it's pretty stressful. Several members have tested positive over the summer and are pretty cavalier about the virus, and that's distressing. And there are SWAT trucks and armed guards surrounding the Capitol in every different direction. I was at an event off-site today that I walked down to. In the middle of that event, there was some yelling, and you could see the tenseness of the legislators that were in the same spot, and everybody was looking around over their shoulders and making sure that there was no sort of thing going on. But overall, we feel like that the Capitol has done a good job at least making us feel safe at this level. We feel like next week is going to be the big week, actually, and the FBI has actually put out an alert to all 50 state capitals about some of the chatter that they have picked up on getting the, on folks demonstrating. At what level of demonstration, we're not really sure, but we will be doing remote budget hearings next week. Today we're on day 2. As you can see, or maybe not, you don't know, this is not my house. I'm still at my office. And for day 2 we're here this late working on policy and working on some ways that we can help out and enhance the work that you, the mayor and commission, have done in Athens. And I have used y'all's leadership as a great example of how we can help other communities be safe and manage the pandemic, and how we need to move forward. So we have some great opportunity for some positive things in a very negative time period. But you know me, I'm a cheerleader, and I think there's hope on the horizon, and there's a light at the end of the tunnel, and we're going to get there. And y'all have done a great job of setting a great example for the state. So thank you for your leadership.
Thanks, Representative Fry. Broadly, we've all read about some of the pre-filed bills. Certainly there's great attention, it seems, on the elections apparatus. I don't know that I should, but I will speak for the group and say that I think, we embrace the franchise very heavily here in Athens-Clarke County, and would seek that continued availability of early voting in the drop boxes and absentee balloting, without rationale, be able to be continued.
Yes, Mayor, that's exactly right. And I think we all agree with that. If you look across the state of Georgia, I believe the absentee ballot count for at least our Democratic candidates were at 660 some odd thousand and some change. And that's a number that I feel like we should set as a standard floor moving forward with any policies. We have not seen any sort of legislation, and I can't really tell you what we think may happen, but we'll do whatever we can to try to make sure that people's right and access to the ballot box are not denied, while at the same time offering folks the peace of mind that the elections are safe, as we found through 60 some odd court cases around the nation that were failed. And I believe the only victorious court case brought regarding the election was to actually move a viewer from 10 feet away to 6 feet away on a ballot count. And so that literally was the only winning court case in the whole United States. And so the elections are secure, and we need to talk about that, but we also need to figure out a way to make people feel like they're secure without hindering people's access.
I think Commissioner Link had a related question, Commissioner Edwards as well.
Yeah, related to the absentee ballots, the Secretary of State had a hand count audit performed of those absentee envelopes and found no evidence of fraud. there's no reason to reduce access because, under the Secretary of State's own direction, there was no evidence of any fraud in the absentee ballot procedure.
That's right, Commissioner Link, and I appreciate you bringing that up. No fraud has been found after, it seems like a lifetime ago, but y'all, it was really only about a week and a couple of days ago, we were listening to the conversation between the President and the Secretary of State when the President was requesting that they actually just give the election for the state of Georgia to him. And the Secretary of State actually responded to a question of how many dead people did you find that who had a ballot submitted for whatever reason. He gave none, but the answer was 2. 2 found ballots that they thought might be invalid. He didn't say whether they even invalidated those or not. And so I think we're making a mountain out of a molehill. I think we're seeing a bunch of people who are just looking for a problem to pretend to solve in order to make it harder for citizens to vote in this state.
Commissioner Edwards?
So, Representative Fry, the fact that this one election monitor in Pennsylvania was 4 feet away, 6 feet to 10 feet, that doesn't swing 6 million votes to Donald Trump, does it?
And I can't honestly answer that question except for to say I don't think it does.
Yeah, that one court case where they prevailed, where the election monitor was allowed to move 4 feet closer, that didn't swing the election for Donald Trump.
It doesn't appear to.
Well, I'd just like to say, thanks for the information. Thanks for being a great colleague. I really think of you as a colleague. Whenever I have an issue that has state ramifications, you're accessible, you're professional, and you're doing a great job for Athens. So I'm thankful for the partnership we've forged between your office and this commission, and I look forward to working in the future.
Thank you, Commissioner.
And I know Commissioner Thornton had a question as well.
It's not a question. I do want to thank State Representative Spencer Fry. He is representative in and out of season, not just election season, but also when it's not election season. And I don't want you to think that I take it for granted, and appreciate you so much. I do want to echo, and I'll do this every time, that people of color stepped up this year. They stepped up, and they stepped up in a way that if you want to continue this trend, that we, those of us that are in these roles and positions of influence, we don't forget about them or forget about us, because I'm one of them, until the next election year. And I don't think that we have been included in a lot of the decision making, but we definitely showed that we made a difference. And I was on a conference call Zoom meeting today, which is with the National Citizens Participation Group, and we were talking about women and young women and old women like me that still are trying to bring people along. So I hope these gaps, this space between the next election, that we don't see folk coming to us for our support and nothing has changed. So that's what I mean by State Representative Fry. He's in and out of season representative. And I think we all can learn and model and follow the example that he's shown for all people. So thank you, State Representative Fry.
Thank you, Commissioner Thornton. And we've had these discussions before, and I would encourage that exact same message to any colleagues or any other elected officials that might see this video, is the idea that our citizens are valid year round, and they need us to reach out to them year round not when we just need to win an election. The African American community statewide stepped up and helped flip the state to blue on 2 very crucial elections. And hopefully we can continue that in the future and learn from this election for future elections. So thank you, Commissioner.
Commissioner Link.
Yeah, I just want to add, for the public that's watching, Representative Fry has been extremely involved in our response to COVID, especially when it comes to testing. If it were not for all the hard work he's been doing, we wouldn't have had that mobile unit. So I just want to say thank you to Representative Fry for all his hard work throughout the pandemic. Even when, he was not in session, he was busting his butt to keep this community safe.
Thank you, Commissioner. And to speak to that, the mobile clinic, and that was something that I've actually been working on this evening, and I'm hoping that that our community can set an example for the rest of the state. And we've been collecting the data so we can actually make a case to the state to invest in this potential for healthcare around the state in the future. And I think this is the way that we should be able to get rid of this pandemic, give people the vaccine, maintain testing so we can keep our everybody safe. And I think this will be a reaction that we can have in our back pocket for any future pandemics as well. So I am working with the budget office and some of the leadership to get this done. And hopefully we can get that clinic back up on the road soon and finish this drill.
Thank you.
Commissioner Davenport.
Thank you, Representative. Just a real quick question about redistricting and when does it start, and walk me through the process and any concerns that you may have.
That's a great question, Commissioner Davenport. Redistricting is obviously on everybody's mind. Redistricting is also known as gerrymandering, where the folks that are in charge of the redistricting get to draw their own maps to increase their influence, but the voters don't really have a say. Certainly, the first step we will have to wait on the census, because all districts are drawn by population, and as an area's population increases, I think they try to get within 1% of either way on the population of a specific district. And so we are looking at that very heavily. For obvious reasons, the census has been delayed, and we hope to address that in the near future. If not this session, I believe we will have something to look at by next session. But I'd like to work, as you know, the local delegation's responsibility is to work with the mayor and commission on the districts in Athens. And so I just want to make sure that I will do everything in my power to make sure that the districts are fair and just to the citizens of Athens, and that we can make it as least of a painless process as possible. I have not actually served through a redistricting. I was elected after the 2012 redistricting, and so the process itself will be new to me, but we have already been working with the MAP team, which is located in this building, and looking at the potential population changes, but we won't be able to know anything until until the census is actually released. As soon as that is released and I know the district sizes, then I will certainly be in touch with you all and let you know, so we can have a full transparent process as we go forward.
Great. Thanks for that overview. Commissioner Denson.
There we go. Yeah, also just want to join everybody. Representative Fry, thanks for always being a phone call away and being so responsive. Also, having the best mustache in the Golden Dome. See you.
My first one ever. I love it. Thank you. Thank you so much, Tim.
But and just showing appreciation for you actually coming and prioritizing being here with us at this meeting. I mean, just for the public, This is not a meeting with all of us, just with Representative Spencer Fry, but with our local delegation, which includes Senator Bill Cowser, Senator Frank Ginn, Representative Marcus Wiedauer, and Representative Houston Gaines. And hopefully we will be able to have this kind of rapport with them also, because it's important for us. Y'all work as a delegation, and we need to make sure that we have that rapport happening with everyone. So I just appreciate you prioritizing this time and being here with us.
Thank you, Commissioner Denson. Anytime. I can guarantee that anytime.
Representative Fry, I echo everyone's appreciation for your constant engagement with us and with the community at large. I mean, I think you represent Athens well in Atlanta. I see Commissioner Houle had a question.
Thank you, Mayor. Yeah, I can jump on the echo bandwagon here and say I very much appreciate your time here and in the many days and years before now, Representative Fry. And, echoing Commissioner Denson, I would like the opportunity for this body to connect with the whole delegation at a future date. If we can find one that works better for Senators Cowser and Ginn and Representatives Gaines and Wiedauer, if you wanted to pass that along, or if they happen to see this video, do you think that would be really important and hopefully fruitful for us to do? I am curious if you, Representative Fry, see any items on our list that seem viable to you for you in the legislature to advance in this session, or if any of them echo something that is already in the works in a given committee?
Great question. I think y'all have worked and given us a great list. As you know, I really pushed hard for the homestead exemption last year, and it got hung up. And I'm hoping that we will be able to move that forward. That shouldn't be difficult, as that is local legislation, and it would only take 5 of us to do so. The gratuities clause definition, we will need to work more with the Attorney General's office. There seems to be a lot of, different opinions on that gratuities clause from one extreme to the other. And so that's a constant thing that we've been working on for about 3 years now. And really all we need is a definition of it. Some of the other ones, I know the number 4, the radar in the neighborhoods is actually, I've dropped a bill regarding that. That is a statewide piece of legislation. And so I can talk to the Transportation or the Safety Committee about the possibility of that to see if there's any appetite to move that forward. Interestingly, a lot of folks in rural communities are a lot more sensitive to that because of the old speed trap stories from, I guess, the 60s and 70s, when communities would literally put speed traps up. And that's an interesting historical piece of legislation. Deceased candidate, I was asked to look at that piece of legislation today. And so I actually have seen that bill. And I was told that you would be asking for it. But before I signed it, I wanted to confirm that that was a request. And then the local government grocery sales tax, we can certainly, one of the things that is highlighted with the majority at the Capitol is local control. And so I think that there's a very good argument for that to be able to be done. But as you know, it's still very difficult to move just one piece of legislation through during a session. And especially, we only have our calendar for the next couple of days. We don't even know what the schedule is after the 27th. And we will be in session for 2 more days this week, and then we will be off until the 27th. We should get more information about that, but I think that's going to depend on how the pandemic is running. If we can get it under control in 11 days, which I'm not sure that's possible, or what. So a lot of this stuff is up in the air. I know one of our priorities right now will be the mid-year budget, to try to make sure that our revenues are coming in the way we predicted, and to make any adjustments that may be necessary. Next week will be budget hearings, and I would encourage our viewers, as well as the Mayor and Commission, that if you have an interest in a specific department, that you could look on the House website, and there will be videos that you could watch of the commissioners of each department explaining the budget to the legislators. So that is where you can get a lot of information on that. But we're just going to keep pushing, and I really hope we can get that homestead exemption through this year. But this is a great list. Thank you for the work that y'all did on this. I think they put the citizens first, and that's extremely important. That's what we're all here to do, and y'all are doing it.
Or Representative. Oh, if I may just provide a comment before I hand it off. Is that all right?
Yeah.
Thank you for running through that whole list, Representative Fry. And for what it's worth, given that the circumstances involving one of my elections this past year precipitated number 5 being on our list, I just want to share that I'm in full support of that as well. And so I'd love to see that passed, as well as hopefully serve as an opportunity for other election reforms more broadly. Number 1 on our list, I think it's number 1 by no mistake, but I feel personally like that's the most important thing we can do on this list for the people of our community moving forward. We're in an affordable housing crisis that's only getting worse as COVID continues on. And so anything we can do to alleviate the pressure people are feeling around affording their housing can make a huge difference. So if there's any way that we can support advancing that in some capacity, would love to hear about that moving forward as well. Thank you.
Thank you, Commissioner Huell, and I appreciate your input on number 5. That was one of my concerns, and just want to make sure that I checked with y'all before moving forward on that one. But I'll pass that along to the local delegation, both your comments.
See, Commissioner Wright and Commissioner Thornton again.
Thank you. Hey, Spencer, thanks for being here. And I agree with all the compliments you've gotten, so I'm not going to repeat those. I think I might have zoned out. Did you have some feedback on the local regulation on the septic tanks? I might have missed that.
I did not have any feedback on that particular bill. I believe, as we have discussed it in the past, that might be a statewide bill, but I have to pull my notes because I think we talked about this.
Yeah.
Maybe 2 years ago. Golly, even March, which was 9 months ago, seemed like a lifetime ago. So
right.
I skipped over that one on purpose because I can't speak to it.
Okay.
Right now.
Well, I can understand that with the public health crisis, with the pandemic that we're in, that the public health with the septic tanks is probably getting a little bit of a back burner. But if anything's percolating, no pun intended, in the legislation that you're reading about, please know that we want help at the local level for keeping safe waterways and yards and septic fields and stuff. And on the revenue front, we have been getting sales tax revenue of $2 million a month, which is comparable to a year ago. And I can't help but want to compliment you and the others under the Gold Dome for the April sales tax on revenue that you guys had expanded. That has, I think, really helped us during this time of challenges in the hospitality area. And on that note, I was hoping that the state would also take on the opportunity to also engage with vendors who register places for Airbnb and short-term rentals. If at the state level, we could have the state connect with them to start getting the revenue so that everybody in the state is able to get charged that by the vendor and then turned into the local municipality, similar to how you guys have done the sales tax.
Okay, so would you be referring to the idea that so VRBO would collect sales tax for the municipalities where that location, where that home or apartment or whatever is located? Is that what you're talking about?
Well, yeah, that started in April with the sales tax changes that were made at the state level. And I guess I'm asking maybe this session or however long it takes is to add in the hotel motel taxes, because those are not at the state level as the sales tax. And I think that that would give the whole state that revenue stream that is not consistently done because of the challenges for local municipalities to be monitoring that, as well as for the individual. But the larger company that's actually doing it and registering, they have that interface like they're doing now for sales tax. If we could add the hotel motel, that would give a revenue stream that we're not seeing right now for the whole state.
And just to highlight how we've been kind of pursuing this question that Commissioner Wright, I think, wisely raises, we are right now seeking a vendor that essentially will scrub the web and identify all those short-term rentals within the boundaries of Athens-Clarke County. There may be some efficacy around the state taking on that role, so that we in Sandy Springs and Savannah and Valdosta and Lake Blackshear and every place in the state don't separately have to have our own little, web scrubber, but that there's a comprehensive view.
Excuse me, I'm making some notes on this right now.
And the good news is, Spencer, that ACCG has this as one of its 6 policies. So they'll be lobbying on behalf of the county commissioners of Georgia. And I know that they make their presence known, but they are also wanting to make sure that local municipalities also chime in for the assistance on that.
Got it. Thank you for bringing that up, Commissioner Wright. I appreciate
always
that.
like to get revenue stream to come in as needed. Thanks.
You mentioned the budget a couple of minutes ago, Spencer, Representative Fry, and that there would be some reporting to the Assembly from each of those areas, natural resources, education, and so forth. Do you have any sense of kind of local impacts of where either the mid-year or the full fiscal year budget may go?
Not really. I mean, the sales tax has been, collections have been floating up and down, but we did have a pretty good month last month. I think in the past, collecting, like you said, Commissioner Wright, these large companies that are doing business in the state, remitting those sales taxes back to the state has been a part of that. And that was an issue that we addressed a handful of years ago. The only word we've seen so far is that the governor does not expect any cuts. And so he has not instructed any of the departments to come up with a cut. I would like to add that, I think it's important for both Democrats and Republicans to understand, and I feel like you guys have a handle on it. When we get this pandemic under control, our economy will move forward. I mean, that just seems like the easiest no-brainer way to think about things that have gone on. And it's not, the economy isn't in trouble because municipalities are shutting businesses down. The economy is being affected by people who are not going out shopping and spending money at our restaurants and our stores because they want to stay healthy. And so as soon as we realize that as a state, we'll be able to be in a much better position. But at least from what we've seen, there shouldn't be any cuts from last year so far.
It's good to hear. Well, Representative Fry, we can't thank you enough for all your work. This list of requests for the delegation has been forwarded to kind of the full body, Senators Ginn and Cowsert, and Representatives Wiedauer and Gaines and yourself. And certainly if any of you have questions about the particulars of any of these items, we stand ready to continue to engage.
Absolutely. Well, thanks so much. And I'll tell you, if you are, I'm still getting thousands of emails about the election. We're still not out of the woods. Next week is going to be a very difficult time for our country and our state. And everybody just needs to take care of themselves, take care of their family, take care of your constituents, and let's get this place put back together and set off on the right foot. We can do that together. I have great confidence in y'all's leadership in our own community, and I thank you for the companionship and the work that we do together. And if y'all need me, you know exactly where to find me. And I'll be headed that way here in about 30 minutes.
All right. Well, be safe on the floor and on the road.
Yes, sir. Thank you so much.
Take care now.
Thank you.
All right. So for commissioners and for the viewing public, we are now going to move to the second part of our executive session. We apologize for the back and forth, everyone, but that's sometimes the way that the clock works. So for Todd and public information, we're going to go back offline so that we can do the second segment of our executive session. All right, everyone out there in the public, welcome back to the Mayor and Commission work session of Tuesday, January 12th, 2021. We, for two items tonight, are going to be joined by Derek Doster, our SPLOST project administrator, who's going to talk first about the Lexington Road corridor improvement and then the Atlanta Highway corridor improvement process. I think more than project tonight. Manager Williams, I don't know if you want to kick this off or toss it over to Derek Doster.
Thank you. I appreciate that. And just by way of mention, these are two funding sources that find themselves in the TSPLOST 2018. And these were projects that were created for the Atlanta Highway Corridor and Lexington Road Corridor. There's another one, by the way, we're not talking about tonight for Prince Avenue. And so there was a user group appointed that was blended with some committees that were already looking at the corridors and not just transportation, but overall. And so the Mayor and Commission's direction, we combine those, so slightly larger user groups than we're accustomed to. And they, we have the benefit, as somebody said earlier, we're not afraid to study things. And so we do have the Connect Athens and the Athens in Motion plan. We have a number of previous studies that the committees with the corridors have been looking at. And so they've got a number of projects they've identified. And going on the theme that we've heard continually from y'all with citizen engagement, to go out and get some more citizen engagement before the priorities, so the committee can come up with some priorities and then present them to you for approval. So tonight really is talk mostly about the public engagement process, so you're aware of what and how the public's going to be engaged regarding these projects. So with that, I'll turn it over to Derek Doster.
Thank you, Manager Williams. Good evening, Mayor and Commission. Being late already in the day, I will go ahead and share the PowerPoint for this evening. As it was presented to you earlier, or when it was sent out by the clerk's office, we packaged these projects together, hopefully to save some time and reduce some duplication on the presentation itself. Again, Lexington Highway and Atlanta Highway corridor projects. Our purpose tonight, as Blaine said, we wanted to just kind of get in front of you some examples, some information that we'll be sending to the public. That way that you wouldn't be surprised if there was questions asked or how we could direct that traffic. Really go over the public engagement timeline and process, because that's really important. It's probably one of the main important pieces of this program is how to get that public input, the amount of time it takes to do that. And we've been doing that, with different departments over several projects now and over a certain time. And, we're learning as we go. I think we're doing a better job corporately, but we know there's always rooms for improvement. So that's one of the key focuses tonight, and that's why we went ahead and put that public engagement timeline up there. We're here tonight, and then of course we'll move through the public engagement process and come back hopefully with some priorities back in the summertime. But again, won't read all the agenda. The user groups, we had several extra members on there that over time has taken a little hit. One of our citizen members needed to step off due to personal reasons, and then of course with some staff changes, we've had a little bit of an involvement or the user group evolving into who we have now. And then we've got our voting members that take a large chunk of time and an effort to put in these projects and put in their efforts. And then we've got the supporting staff and departments again that are helping pull everything together with us. Not to belabor on some of the history items, but again, as Manager Williams mentioned, that way back, seems like way back now, but 2013, the Urban Land Institute started with some of the Atlanta Highway corridor projects, and of course, that moved into Lexington Road corridor projects. The AIM Commission prepared the bike and bed master plan over several years ago, and then the planning department had a large effort in leading the teams on the Atlanta Highway, Lexington Highway Road corridor studies. And while again, a lot of these projects had a great amount of public input on them and involvement, and they really have been building blocks and a good foundation for where we are today. There's, all those studies identified just multi-million dollars worth of projects, and how do you narrow that down to something more manageable? That was one of the tasks that we have with this project. Again, history, and one of the things that we're doing is we're putting all this information on the website that we're developing for both corridor projects. So those that want to take a deeper dive and do a little more study on some of the past reports, that information will be easily and readily available for those participants that want to do that. And so that information will be on the website as well for all the Urban Land Institute, the project corridors, and Athens in Motions. Again, just another slide of the Connect Athens corridor study. About a year ago, we started in earnest with the user groups, started talking about what this project is, taking it from the initial project statement, bringing it to you with some public input, getting your blessings on some potential projects that we wanted to try to mature as we move forward. So over the last and those projects included the Lexington Highway Corridor. This is the potential project, the approved potential project list that was developed that you approved in July, and as well as the Atlanta Highway Corridor. We'll remind you that there's several small of those projects that you gave us permission to go ahead and begin. On the Lexington Highway Corridor project, I apologize, I slipped through that one very quickly. But with some wayfinding signage for the airport, we have that completed already. And then on the Atlanta Highway Corridor, some of the immediate impact projects landscape management is working with the DOT to get one of the locations that was approved out on the Atlanta Highway done. So that's in a permitting process with the DOT. So hopefully in planting season this winter, we'll be able to complete that. And then our traffic management team was able to go out and add a few signs and freshen up some markings out there on that advance to in front of the mall where the lane drops off there at the racetrack. So we appreciate their efforts on those. But after those projects, again, as Manager Williams suggested, that we did add a few members on our team. So we've worked diligently over the last half of last year to not only just kind of relook at these projects, but how to and when and why, all the good questions that we need to ask, how to take that back to the public and get public engagement. And we know that's one of the large tasks at hand that staff's been given, is how to better engage. We think we've done some things well in the past. There's always room for improvement. And so one of the things that the group wanted to talk about, how to distribute the information and what to distribute. The user group, all the members of the user groups wanted to really make an effort on educating the public prior to getting their comments. And we know that's, when I say daunting task, not that we don't want data overload, if that's what I'm trying to say, is we want to be able to put it out in a concise manner that people can read it, understand it, and then process their thoughts and comments and questions back to us, so the user group can utilize that information to help prioritize and bring a better formalized project list back for your blessing at the appropriate time. Again, one of the things that we wanted to do is build off some of the previous work, that foundation effort that had previously been done. This is just an overview map of the Atlanta Highway Corridor that came from the Atlanta Highway Corridor study. And so we did that and built off of some of the previous program work that's been done through Leisure Services and Transportation and Public Works, utilizing the Geographic Information Office. This is a website that we're building for the Atlanta Highway Corridor. Again, it's a storyboard. If you've visited some of the Transportation and Public Works or Leisure Services works that they've done in the past, very similar in approach. And so for this example, we've got the Atlanta Highway Corridor. And we're really excited about this. Joseph and his team has really worked wonders on trying to get this stuff pulled together. But when you pull up the home web page, it'll have an overview map. It'll have the projects identified, as you can see on the map itself. It's an introductory tab. What is Atlanta Highway? How is it defined? What are the projects? What's the budget? And how can the citizen or the participant help and get that information back to us in a proper manner? So when you pull up the tab, again, apologize, we did some screenshots to help move this more quickly. Some of the background data over the WebEx program takes a little time, and the map seemed to not move as quickly as we would like, but we're still working on a few of those bugs and wrinkles. The introduction tab, again, it pulls up an overview map. This is just a blow up so you can see the different types of projects that have individual indicators. So each project has its own individual number. So it would make it easier for information to be provided, distributed, and collect data on each individual specific project. And that was very important to the user group members. Again, continuing on with the example of the web page that's being built, is that at the top you have the tabs, and it's a little blow up of the tabs. So you have the introduction tab for Atlanta Highway. We've got it broken down to 4 groups: transit and bus stops, roadway improvements, and sidewalks and trails, and then the subsequent survey at the end of the storyboard. So, for example, if you go onto the Atlanta Highway, when it's ready, go onto the Atlanta Highway website and you click on the sidewalks and trails tabs as it's highlighted there, it'll take you to the next drill down page where it'll have the several samples of those individual types of projects listed. And with those projects, there's a brief description, kind of project considerations or the effects of the projects, what is being proposed, a rough magnitude of cost and a scale that goes with that, again, similarly building off of some of the previous work in the previous studies. The user group was concerned that providing an actual dollar amount, that citizens or participants in the survey and in public input session may focus too hard on, an exact dollar amount, when we want them to understand that there's cost involved in an order of magnitude, but to try to provide the comments in a most honest and open fashion as possible, so we can get the user group and get that information back to y'all and help us. And our end goal is to get data, and then we utilize that data to help prioritize the project lists that you've blessed for each individual Atlanta Highway and Lexington corridor. One of the things that you can see right in the middle of the screen, you can see an attachment on the pop-up page. You click on that, and that will take you. Oh, I apologize, I'm jumping ahead. Again, the Atlanta Highway, you can see we tried to blow that up. It's where you can see a little bit of the information, the order of magnitude cost scales there, and you can read the individual project descriptions. And each one of the projects will have that as filled in, and you can be able to follow that through the website for every project.
Derek, do you mind if I ask a quick question about that?
Yes, sir. About
the tabs and the information you're providing there. And,
yes, sir.
And I'll be real quick. I know we got a lot to do. So the descriptions, I like this. I like what you've done with how you're laying all this out, and it looks real easy, user friendly. The one thing I will say though is certainly when people are commenting on these and deciding which ones they would like to see, would it be helpful to have something laid out, like some of these areas that we have projects for are now in the TAD district, so there's other revenue sources, I guess what I'm saying about this. So I don't know how you can do it, or if you should do it, or what, but I think it's helpful when we're giving the information if people know, like, okay, these, like you have on here, these are GDOT roads, but also this is within the TAD approved area, but then you have to get and explain what a TAD is. So you see where I'm going with that?
Yes, sir. We've had some extensive conversation about TADs and alternate funding sources with the user groups, and some of the reference material, if you would, some of the additional information we want to be able to put on the website for those that want to take that deep dive. Again, not only the previous studies that were done. For example, one of the things we want to make sure that's on the website is it's not funding related, but it maybe similarly as an example is. For example, Atlanta Highway, the bypass, we know the Department of Transportation has a large project that is involved, and somebody may not know that's going on. So we want to put that reference project concept, even though it's not being driven by the local government, it's being driven by the state, but let them know that that's a project that's upcoming and give them some project data on that. We can work with the manager's office on some of the additional information, such as TADs and those, to see what may be appropriate. Yes, sir.
Yeah, that's perfect. Thank you. That's all. Yeah, that'd be perfect. Thank you.
Yes. Jumping back in on the tabs, I mentioned earlier, as you pull up each individual project, there's the project description, a little bit of a data, and there's an attachment. And I think this is one of the most important and key parts of it is it's a blow up. It's a more static image than the map that's actually interactive that GIO is helping put it together. We're working to try to get some information that we can take to the public, something that we can print out, something that we can, hand to someone to take with them to whatever group or organization or person that may be interested in. We acknowledge the fact that not everyone may have, great internet access or any internet access or have the capabilities to scroll and look and spend, as much time as they'd want on that. So we want to make sure that we've got opportunities and information that we can package, kind of like a data book, if you would, something that we can take these project data sheets out into the public, and we can talk about that a little bit more as the public engagement. But this is an example of one of the attachments that you could pull up as you use the website, and that provides some continuity to those in-person sessions that we can speak about in just a minute. But again, this is Atlanta Highway Corridor, and it's the tab, kind of a project data tab sheet sample for the attachment. At Lexington Highway Corridor, again, just very similar to the Atlanta Highway Corridor that we just spoke about. And again, it was not trying to give you each particular project, but samples of the information that we're trying to put out to the public. Again, building off our old reports and our foundational work, Athens Corridor report map. Again, Lexington Highway Corridor, the same type of information that we want to provide, except for the different location and different projects, but same process and same information. And this is just a small example of one of the projects with a project data sheet that could be pulled up as a informational graphic. So this takes us to the exciting part of the project, is what do we do with this information and why do we want it? And the purpose and the intended outcome of that public engagement, of course, is to get data back to help us provide a better and more qualified recommendation to Mayor and Commission. With that said, we want the public to be better engaged about the potential projects. We want to be able to make sure that we get to as many public venues and be able to sit down with people. I still think, and I say sit down, we know that we live in a pandemic world right now, and we want to be careful to do that. But I think we can build on some of the successes that we've had recently in the past in doing that. The user group has really asked for this information. They want a well-given information so they can dialogue and debate what they want to recommend. They've taken this, to me, they've taken it personally in a good way. They want their time to be utilized in a manner that helps move these things forward. Again, there's multi-millions of dollars worth of projects out there, and if you just broad brushed everybody, I don't know anyone who wouldn't say, transit's important, roadway's important, bike ped's important. Those are those large, broad brush approaches, how we're trying to dive in to actually get to an actionable item on a particular project or two. And those particular projects or two will come forth with the user group recommendation with a prioritized list, and bring that as a project concept, allowing us to move that forward. Our public engagement strategies, we've had good conversations with not just our user groups, but with internally, corporately as well, with some of the internal staff members, and just trying to build a larger coalition of who we can speak to, who we can get that out, get that information out to. Again, kind of 4 points of that engagement strategy. Of course, online, we've shared a little bit of the website and story maps that we're trying to build. Public information is gracious with the social media platforms and the other government platforms that we can utilize that are appropriate. We realize some platforms may not be appropriate. In-person sessions, again, the traditional drop-in sessions, if we can do those in a safe manner at a fire hall, meeting room, whatnot. We've recently held several of our Firefly Trail alternatives in a public arena. We utilize tables. We utilize members of staff to kind of coach those that were attending to maintain their distance, masking, those kind of things that we think we can do. We want to be cautious, but we also want to provide those opportunities for those that really want to come engage with us, and we can hear from them. And again, and that may be for personal reasons they want to come out and have that conversation with us, or that may be technology that may not be able to give them an opportunity to do so. Another thing, building on some of the previous successes that's been going on is, I don't know how many remember, but during the Trail Creek Bridge project, we worked with Leisure Services to get what I call the little pop-ups or pop-up tents and tables. Identify some of those locations. For example, could be a Lowe's, could be a Walmart, could be a Publix. Some of the larger areas or larger businesses in those corridor areas that we could go to on a Saturday or half a day and just have that information there and be able to encourage people to go take the survey, encourage people to engage in the process, at least when they're coming and going, at least kind of put that back in front of them instead of just an email blast. We know that's important. However, we know we can do better, and we're trying to do better with some of these additional opportunities. Community partnerships, honestly had a great call yesterday with the Neighborhood Leader Program, and really excited about that. They've invited us to come back and share a little bit more with these projects. So again, something that's new that we haven't done in the past, but something that's exciting that we feel like we can get in there and get information out to them and allow them to get information back to us through the surveys and data processing. Again, we've always tried to go to church or other civic groups that have asked, and just trying to really identify those that we can get to. And again, the normal partnerships that we do have, utilizing those. One example is, the public utility, the quarterly insert. We know that reaches, I forget how many thousands of people that reaches through the community, but it reaches a lot. It may reach people that don't ever get on a computer. It may reach people that do. However, we know, those are the kind of things that require some timing and some planning to make sure that we've got that information in that insert. And so when it gets, goes through the mail, gets delivered, we don't want a citizen or a business person to get that quarterly insert and open it up and say, oh, I would have participated, but I didn't have enough time. So we're trying to take into consideration all that effort. And again, just other partnerships with the government, like through the Economic Development Department and our Chamber of Commerce. All that comes back to the timeline. We mentioned it takes some time to get the information and get it processed. Building on some of the opportunities and successes that we've had in the past, we mentioned other departments, but Leisure Services, the Greenway Network Plan, some of these programs that are broad-based and not just one specific project driven, it takes a little bit of time to get the word out, try to truly engage with those people, get information in their hands, let them digest it, and then allow them opportunity to get back with us. And so we've laid this this timeline out with the user group, both user groups, and work with them, and they're favorable on this time frame. Again, I was speaking of the quarterly insert for public utilities. It goes out the 1st of March. So given an opportunity to get that information in it, get it out, and get an opportunity to get that information back. So it is an extended period of time. It's a little quicker than probably I had envisioned earlier on when you asked us to hold no public input sessions over the holidays. And honestly, after going through this process and working with the user group for some extra time, I think that was the right decision. And I think it has evolved into a better product. Again, no process is perfect, but I think corporately it's going in the direction we want it to go. So we can take the charge that you've given us to truly try to engage the public, get that information so we can turn it back around in a manner that's useful, not just checking boxes. So we want to make sure that we're doing this and doing it correctly. We shared the timeline. So what we want to do between now and then is we've got some web page development in the presentation materials to finalize. We're close, but it seems like any time I did a paper in school, every time I read it, I proofread and needed to fix something. So we're trying to take these last few weeks to get this information dialed in the best way we can. One of the things we do need to do is finalize the dates and times and locations for our in-person sessions. So when we go live, we can publish those, or at least let people know that those dates will be coming. And again, with that extended period of time that we showed you, we don't think that will be an issue. Finalize, go through our public engagement effort, get our user group, get that data back, let them process it, develop the project list. And we want to prioritize those lists as they come forward. So for both corridors, we will have a prioritized project list, regardless of cost, similar to some of the master plans that we've done in the past and similar to those other types of projects. We have a budget. However, if we want Mayor and Commission to see what is a high priority to the community, and if, at that time, working with the manager's office and the Mayor and Commission, if additional funds are needed, or if that lends a case to make a better presentation to some of our state and federal stakeholders, or if it sets us up for the next conversation for the TSPLOST, which won't be too far down the road. And then, of course, come back to Mayor and Commission and during the summer period and let you approve that, or hopefully approve that, or at least continue the dialogue and give us better direction on where you would like to see us go. This is just an overview of, we have 2 slides of Lexington corridor and Atlanta Highway. This is just an overview of the process to date. You can see where we've started, where we are across the board, and then where we want to go. And again, and bringing back some of those preliminary plans may depend on timing, on the complexity of those types of projects, whether the state, local, federal dollars are involved in the type of project that you want us to take on as the project concept. Same slide. And I will stop sharing and open the floor for questions and turn it back over to the mayor and the manager.
All right. Thanks for that, Derek. I appreciate it. And looking forward to seeing the public weigh in on these opportunities. Definitely interested in input from anybody who's got questions or thoughts. See Carol and Jesse.
Okay, I have my mute unmuted. So Derek, I have a bunch of questions. Some of them are easier, and one is that I think the last point you made about the information being used for future grants and for future TSPLOST projects was very relevant to a question I was going to put forth, or a comment before, about the $4 million pot that we have in the TSPLOST program. And I think some way to put that really succinctly at the beginning of your presentations and on the website would be really good, because one thing you just told me then that was very convincing to me, because I was like, why even have a flyover in here? I mean, that's going to take way more than $4 million to do a flyover. But being right up front with citizens and people who are interacting that this is one, it has a short-term purpose of helping us figure out how to spend our $4 million in TSPLOST that we have right now for future grant funding projects and matching grants, and also for future TSPLOST programs coming down the road. I think that's really important to put up front. Another thing I wanted to just mention was, I mean, this is very similar to the layout you're using is what was used on the Firefly. Is that correct? In the Greenway or the new Greenway plan, or is that?
They're very similar. Actually, the example that we shared with the user group was a Transportation Public Works Jefferson River Road project, and that was very well received. It's such a, and when I say small project, it is project specific.
Yeah.
And trying to pull that out to a more broad approach was, that it is challenging.
I was wondering if there was any comments on how the quantity and quality of feedback using this approach, how Transportation Public Works felt that was compared to, or any of the other departments compared to stuff that's been done before, because this new sort of interactive layout that you're using. So the quantity and quality of the comments.
I think good comment, a good question. I think the quality of the comments are probably, I don't want to speak for Transportation and Public Works, but my understanding is that the quality of the project or the comments are a little better because the person that takes the time to go through and educate themselves can provide a little more detailed oriented comment. However, we still need people to provide data. For example, this project, when we went out for public input in the past, with the emails, the media blast, the kind of more things that have worked in the past but not well enough, is generated only about 70 or 80 comments. Mm-hmm. And for having these two very large, very important corridors, and we recognize that to the community, we need to up our game, and we've been tasked to do that and challenged to do that, and we're trying to do that. So I think the quality is probably a little bit better, but we also need, not quantity just to stack the numbers, but we want to hear from everybody.
Yeah, I think some of those, those interactive websites are really interesting for those of us who are really involved, but I get fearful that it loses people as well because it requires so much concentration there. Do we have a question about at the front end for the person who's filling this in or responding about where they live, their residence, whether they're a Clarke County resident, whether they travel through here or live in the area? Do we have any demographic information about that up front?
It's part of the survey package. We are asking for some of that information to be able to track that, to have a better understanding of who's responding, where they live, how they interact with that particular corridor, those types of questions. Yes, ma'am.
Yeah, and the final thing is I just wanted to ask you if you all have considered, and this is not for this project, but for the future, any engagement platforms. Jesse invited me in on learning about a platform called Citizen Lab, and I think they have competitors. Where did I write those competitor names? Down here somewhere, like Bang the Table and Public Input. And I was just wondering whether or not the SPLOST office had considered using any of those those platforms for public engagement.
And Derek, if I might, I know that Crystal Coburn, our inclusion officer, has been looking very closely at Bang the Table.
Okay.
And so we're sort of piloting that particular platform. And what we try not to do, as y'all can appreciate, we try not to have 6 different platforms across the government. And it's been clear from this mayor and commission in the past that citizen engagement is something that we really all need to work better on. So yes, we are looking at those platforms. Derek, you may have something additional.
Specifically to answer your question, those particular platforms, no, man, we've not. But we've been working with the manager's office and the public information and the GIO office on the tools that we have at hand without trying to create, again, a new platform. And I believe in speaking with the manager's office and some of the conversations that we've had in the past, I think that's a corporate role that I believe that they're leading on some of those department heads. So we don't want to be too far out in front of that. So we're trying to play along and make sure we get the information that we need and be prepared. So when that corporately rolls out, whatever that may look like, we can participate with that.
Thank you.
Thanks, Carol. Jesse?
Thanks. Thank you for bringing that up, Carol. I'm actually once again wonderfully glad to hear that staff is already working on some great stuff. So I'd love to learn more about Crystal's work with Bang the Table. And I was actually hoping later this week to send some information to y'all from what we learned from Citizen Lab. So hopefully in the future we can have something even more robust, to use a word that I know Commissioner Myers likes. I did have 3 questions, I guess. My first was generally about this process. Is there an ability to open comment, or are people only able to comment on specific projects that are on the list?
The way we've got the survey set up, it's twofold. We have an open comment platform that we're working with our Joe on to make sure all the technical side on the back end works together. And I'll share this: the user groups were both of them were highly interested, if you would, not only in the specific projects themselves, but how each person engages with that corridor. You know, are they typically transit riders? Are they typically business owners? So there's some I'll say broad questions, and then some questions trying to get a specific answer on a specific project.
Okay. And so also, if someone who lives along the corridor, like a neighborhood that comes to mind for me is Stonehenge, and there's a lot of concerns there around people using Old Monroe Road as a cut through and having speeding. And so even though that might not be a particular project on the list, if you started to see a number of comments about that sort of an issue where people might grab onto this overarching project and say, oh, Atlanta Highway Corridor, traffic study, here's my feedback. And that's a concern they raise. Is there a way to integrate that kind of feedback meaningfully as well?
I believe so. I think it may be, ancillary information or anecdotal information that we provide back to y'all, saying it was not one of the project lists that you had already previously approved. However, we did receive this specific feedback that was, seemed to come from a good group of people. So we're happy to share all that information, of course.
Okay, awesome. And then my next question was about site selection. I guess this is maybe more of a comment than a question, but I guess, when we're selecting sites, especially when I think of Atlanta Highway, it's a particularly dangerous corridor to try to walk or bike down, and there's public transit doesn't service most of the people who live directly on it or in those neighborhoods far off of it. And what I've heard over and over again from residents in neighborhoods all along Atlanta Highway, as well as Jennings Mill or the neighborhoods off Fowler Mill and Cleveland Road, is that they feel very left out. And, some neighborhoods tend to be a bit more organized than others, or have people who are a bit more well-resourced than others. And so when we're choosing sites, I guess I would ask for us to really consider equity and trying to get directly into neighborhoods as much as possible, especially some of these lower income neighborhoods that might be lower resource. And I imagine our neighborhood leaders could help identify some of those, but I'd also be happy to help work with whoever's planning that site plan to talk about neighborhoods that, by my understanding, could probably benefit from a more direct engagement. So I don't know if do y'all have like a planned list of prospective sites that you're going to be working from, or?
It's a moving target right now. One of the things that we want to look at, when you said site selection, I apologize. I went to trying a different type of process, but I understand what you're talking about now is
public engagement sites. Yeah.
The public engagement locations. So yeah, we want to work with those community leaders and those other groups, definitely all y'all, most definitely, to try to target one of the things we want to be careful on is we want to do the best job we can in the time frame that we've aligned, without overcommitting something that we dropped the ball. We don't want to promise too much, but we want to be able to deliver as much as we can.
Okay, sure. Yeah. Well, yeah, I'd love to weigh in on that further if there's like an email chain or another conversation that I could get looped into. Just because, we've got some great locations like at the fire station or the community extension, but those are actually very difficult to get to for a lot of folks who live out of Atlanta Highway. I imagine there might be some similar complications for different neighborhoods out along Lexington, although I'm less familiar with that. My last question was about community partners. I'm super excited to hear that the conversation with the neighborhood leaders went well. And I was curious if we already have or are planning to loop in CCSD. If the school district might be able to get the word out through PTOs or their teachers to get a lot of involvement that way from people who are regularly driving to schools and things.
They're on our list to talk to. We'll follow the, and I hate to say protocol, but I think public information. I think Jeff Montgomery takes kind of a lead or has a liaison over there that can get us in touch with the appropriate people. And so that's on our list, of our communications list, if that's the best way to say that. So, but we just want to be careful of not, going around protocols that aren't in place.
Sure. Well, yeah, if there's a way, I mean, when I think of site selection or, public input location selection, the schools on a day when there's already PTO meetings happening or something, or, on a meet and greet with the teachers might be really great opportunities to try to get a lot of people to weigh in on this while they're already going there for something else if the school district is amenable to that kind of partnership. So
absolutely.
Thanks.
Thank you.
Great.
Thanks, Jesse. Any other thoughts or questions on either end of Highway 78 or globally? All right, Derek, we really appreciate it. Thank you much. And I think Blaine is going to introduce Marilyn Hall, who's going to talk to us about recurrent activity, although not one that we do that often, which is our service delivery plan, which is kind of broken into components. The one of which we'll talk about tonight is the financial element.
Thank you, Mayor. And Marilyn, thank you for being with us tonight. Just briefly, by way of context for you and the viewing public, the service delivery plan is a overarching plan that the Mayor and Commission approve once every 5 years, and it governs the program of reinvestment in the system and the projects that public utilities pursues, and it has to have, as you know, public utilities is not funded by tax dollars. It is funded by the rates that the users pay. And so this is all plugged into the future rate structure, which of course you review and approve each year. There's 3 elements to the service delivery plan, and I hope I'm not walking all over you, Marilyn. One's the capital element and the infrastructure element. Those have both been presented to the Mayor and Commission and approved. And only when we know what the projects are that you'd like to see and their associated cost estimates, that goes into the financial element. So this is the third piece, and this happens, this review with you and approval, which then precipitates the approval of the overall service delivery plan and gives direction to the public utilities for the next 5 years. So with that, I'll turn it over to Marilyn to present tonight.
Thank you, Manager Williams, Mayor, Commissioners. I'm going to jump right in. The Public Utilities Department Service Delivery Plan is our long-range capital improvements program. And as Manager Williams said, the financial element is a crucial tool in the rate-setting process, especially considering the fact that many of the capital projects span multiple years for design, easement acquisition, bidding, and construction. The purpose of this presentation is to provide you with a brief overview of the service delivery plan, and then I'll focus on the approach to the financial element, things like financial criteria, key assumption, drivers, and goals, and then I'll present the proposed rates and fees for the next 6 years and show you how they compare to similar utilities in Georgia. Before I jump into the financial element, I'd like to review the history of the service delivery plan, and this is for the benefit of the new commissioners, and it's always good to review stuff. The first plan was developed in 1995, and we've updated it every 5 years since then. Every year, we review how we are performing in terms of our key performance indicators and our finances as part of our annual budgeting process, our annual capital budgeting process, excuse me. And we continue to monitor our infrastructure, updating reports and studies so we can keep up with the needs of our system. And service delivery and capital planning is as much of a process as it is a plan, which is why I choose to show you the process diagram as an illustration of a plan. The goals of the plan are to comply with the Unification Charter. The Charter requires that the Public Utilities Department adopt a plan to provide services to all residents as defined in the plan. Another goal is to develop a plan that supports water and wastewater needs and also fire protection needs. And those are determined by the comprehensive plan. Expansions and extensions of service are planned according to the future development map because we recognize that infrastructure influences long-term development patterns. Our next goal is to design our infrastructure to protect or improve water quality, protect public investments such as conservation and recreational green spaces, and avoids impacts to environmentally sensitive areas like wetlands, buffers, and floodplains. And last but not least, the plan aligns with the Mayor and Commission's strategic commitments and goals. As Manager Williams said, the service delivery plan is divided into 3 volumes: the infrastructure element, the capital improvements element, and the financial element. The infrastructure element evaluates our existing facilities, develops estimates of future water and wastewater needs based on population projections and the future development map, and it identifies the water and wastewater improvements that are needed to meet those needs. The infrastructure element identified 59 projects over the course of the next 20 years at a total cost of $400 million. The complete infrastructure element, as well as videos that briefly describe the projects in the service delivery plan, are available on the website accgov.com/SDP. The next volume of the capital improvements element the next volume of the service delivery plan is the capital improvements element. It was approved along with the infrastructure element back in August of 2020. It defines specific project and implementation priorities and assigns each project to a particular category and then ranks the projects within each category. And there are 6 main categories. The first is public health and regulatory. And these are things that are required by our permit. They are things like the additional treatment requirements by our Environmental Protection Division, and they ensure that we comply with the Clean Water Act and the Safe Drinking Water Act. The second are public health initiatives, and these are community-directed projects. The project in the plan is alternative sewer solutions. And the next category is rehabilitation and replacement. It's by far the biggest category, and it accounts for more than half of the expenses of the service delivery plan. It's the biggest category because it is extremely important that we reinvest in infrastructure commensurate with physical depreciation. In other words, we don't want to accumulate a backlog of maintenance and overdue capital improvements. We reinvest in infrastructure to sustain the level of service and reliability. The next category is system expansion. This includes water supply projects, for example, the transmission mains and other infrastructure that we will need to turn the quarry into a water supply reservoir. It also includes expanding the diameter of existing pipes so they can meet higher demands and provide better fire protection. System extension projects serve new customers with new services, for example, the water recycling, and extending sewer service to customers within the service area. Finally, there are 2 projects that don't really fall into the other categories very well. They relate to our key performance indicators, and they are alternative energy projects and implementing a new billing system. These are the top 10 projects we will be doing in the short term. They're prioritized based on the date of need, not necessarily on their priority category. I think the clearest way to explain this is by comparing number 10, future drinking water regulations, and number 3, Tanyard Branch interceptor improvements. The interceptor improvements replace aging undersized sewer interceptor pipes with new, larger ones. We need this now because that sewer is failing. But for number 10, we don't even know what the new regulations will be, so we can't start working on them yet, but we are poised to do so as soon as they are published. One final thing I'd like to mention, especially following Derek's presentation, is that this service delivery plan marks the first time we have implemented a comprehensive public information and outreach effort in conjunction with the plan. We had planned to do open houses all over town and do the traditional feedback and information outreach stuff, but because of the pandemic, we took a different route. We canceled those meetings and we posted videos and the infrastructure element and capital improvement element right online, and provided easy ways for people to ask questions. We had an online form and a call-in hotline where people could ask questions, and then we answered them during a live public webcast. And it was a new thing for public utilities to do that with a service delivery plan. And I'm super excited to see what Derek is working on and the bang the table stuff, because in 2025, that'll be a really awesome way to get more public involvement with the service delivery plan. All right, the third volume is the financial element, and this is what I'm here to talk to you about. The financial element identifies the envisioned general sequencing of the projects. It identifies the anticipated funding sources. It develops the financial forecast and capital planning model. It presents feasible financing options for implementation of the proposed projects and develops a projected rate schedule for the next 6 years. And the ultimate goal is to responsibly reinvest in our system to maintain asset value and protect public health and the environment while minimizing rate increases to our customers. It is a sustainable financial plan that is based on these assumptions. First, it must satisfy our average annual expenses and necessary capital expenditures. O&M, which is operations and maintenance, is a little more than $9 million a year. It includes everything from electricity and chemicals of our 4 treatment facilities, cost of basic repairs and maintenance on our 810 miles of water pipes, 500 miles of sewer pipes, and more than 41,000 meters. Operations of our office and billing systems are included in that, as well as the thousands of water quality tests that we do every year. The capital improvement program averages about $26 million a year. It includes the service delivery plan projects presented a few months ago in August. I guess that was 6 months ago in August, wow. And details on as I said earlier, every project, the costs and prioritization methods are all online at accgov.com/SDP. Another thing we have to include in the financial element as a high priority is reserves. We maintain 3 months worth working capital reserves. The purpose of having those reserves is so we can respond to emergencies. God forbid we have a water main break. But if we do, we have cash on hand to make the repairs quickly. This helps us maintain reliability and a high level of service. We have a $7 million rate stabilization fund. The 2015 bond statement requires a rate stabilization fund. And the ample debt service coverage that is required in the bond covenants, it modulates rates. It protects our customers from unexpected changes and things that affect the utility, like recessions and droughts and pandemics. And then finally, carryover. We have a pay-as-you-go carryover strategy over the next few years. We've been planning and designing for repair and replacement of our collection system and our wastewater system, essentially saving money for moving into construction. It's like saving up for a new car. We need to save up and avoid debt because we already have a fairly high debt load, and this strategy allowed for the purchase of the quarry in this fiscal year, and you'll see that we have a significant pay down over the next few years. Okay, so those are the financial assumptions that we use as sideboards to cover our expenses and capital expenditures. The biggest expense is maintaining and improving our infrastructure, and I need you to notice that we are now focused on the next 10 years The service delivery plan is a 20-year plan, but here we're focusing on the first 10. There's too much uncertainty if we try to detail out beyond 10 years at this fine of a level. And we're going to update this again in 2025, and the 2025 plan will detail our finances out to 2036. All right, so projected capital spending over the next 10 years. You'll see on the chart in the bottom right that spending is front-loaded, and that's because we have the carryover that we're spending down. Like I said, we've been saving up specifically for these specific capital projects, and they're moving into the construction phase. And over the first 5 years, the course of the 10 years, I think the average is about $30 million. All of our water and wastewater infrastructure has about a $2 billion, or more than that, more than a $2 billion replacement value, and about a 60-year life cycle. And this guides us on how much to reinvest into our system. So if you have $2 billion in a 60-year life cycle, it amounts to about $30 million a year that we should be reinvesting into our system, which happens to be our annual average over the next 10 years. This chart shows our revenues and expenses in our financial model. We're moving into the construction phase, as I said, of several capital projects, spending the money that we've been saving up for those projects. Again, we expect sustainable cash flows where cash in matches cash out starting in fiscal year 24. Carry forward allowed important purchases, already said this, of the quarry and construction of 2 of the top 10 projects I showed you on a previous slide in the first half of fiscal year 21. We're well on our way to spending down the carryover this year. Let's see, here we go. One of our goals is to minimize debt financing. Our customers already have a relatively heavy debt burden. The chart on the left shows how we are funding our capital program. And obviously we strive for a pay-as-you-go system, but we are looking to need to borrow money to fund our programs in 2024. We don't want to increase the debt burden on our customers, so we're looking at ways to eliminate the 2024 borrowing. Next month, we're going to ask you to approve an increased, or next month, the month after that, we're going to ask you to approve an increase to our connection fees. These fees minimize rate increases for our customers by shifting a proportionate share of improvement costs from existing ratepayers to new development. This means that updates to connection fees mitigate future water and sewer rate increases. And the rate adjustments that you are itching to see have us postponing borrowing until 2024. And here are the rate adjustments. This seems like a really good time to remind everyone that last year, Mayor and Commission approved and we implemented changes to our rate structure. We dramatically reduced our customer service fees, and we deferred anticipated fiscal year 21 rate increases for the benefit of our ratepayers, and it really helped out our ratepayers. But it does have consequences. It led to about a $5 million decrease in revenues, which turns out to be about 10% of our revenues for the year. The financial model I've shown you assumes a 6% rate increase in fiscal year 22. The proposed fiscal year 22 water rate increase is the same as the cumulative amount that would have been accepted with the 2015 service delivery plan, but deferred in June of 2020. The 3% in fiscal year 21 plus the 3% in fiscal year 22 became 6% in fiscal year 22. The fiscal year 22 sewer rate increase is actually less than the amount that had been accepted with the 2015 service delivery plan. The 2015 plan had 5% in fiscal year 21 plus 5% in fiscal year 22, which would have been 10%. But it became 0% in fiscal year 21 and 6% in fiscal year 22. The slated increases in fiscal year 23 and thereafter are 3% for the customer service fees and 3% for water and 5% for sewer. And I already mentioned connection fees. They're our second largest revenue source. The proposed 22 water and sewer rate increase of 6% will be accompanied by a proposed water and sewer connection fee increase of not less than 12% for water and 7% for sewer. The increase in connection fees helps us keep the rate increases at the low 3% level, and we hope they will reduce the need for debt financing also. The debt service coverage, I talked about this a little bit already. The ample debt service coverage is required by our bond covenants. And this is a total residential bill. It reflects a 3,500 gallons of monthly water usage, and it's a combined water and sewer bill. You'll see that it is $52.95 right now. And in fiscal year 22, it goes to $56.13 and $58.31 in fiscal year 2023, and so on. These are the actual rates themselves. The customer service fees are increasing by 25% in fiscal year 22, then by about 15 cents through 2027. One thing about the customer service fees is we cut them in half. Back in 2020, they were $8.81, and we cut them in half as a result of money saving through our AMI system and other efficiencies that we have gained. And one thing that's really interesting about customer service fees is when they're low, it really helps out people who don't use a lot of water, which helps probably our low-income residents, because they tend to use less water than our higher-income residents. So there's an equity impact to lowering our customer service fees. Onto the tier rates. They are set, we propose that they increase by 35 cents per 1,000 gallons in fiscal year 22, then 20 cents through 2027. Sewer rates increase by 41 cents per 1,000 gallons in fiscal year 22, 36 cents in fiscal year 23, and 38 cents in fiscal year 24, and 41 cents thereafter. How do we compare to other communities? Well, those are our current rates, and we have all the Upper Oconee Basin Water Authority utilities that are included on here, and we are to the left of them. You'll see Barrow, Oconee, and Jackson. Our bills are lower than theirs. Oh, this is based on a 3,500 gallon bill. And the other thing to note here is that these are our proposed fiscal year 22 rates, and we're comparing them to the rates as of November of 2020 for the other utilities. And when you look at these utilities' websites, you see that they have anticipated rate increases as well. So there's a real good chance we will be moving to the left of this chart and be well below average for this group of utilities. I know it's a lot of information, but the recommendations are that you accept the 6-year rate adjustment component of the 2020 update to the financial element. And our next step is that Mayor and Commission hopefully will accept the recommendations next month. And in June, you adopt the fiscal year 2020 budget in rates, which will include the rate adjustments and the connection fees, which you will see next month or the following month. So at this point, I'd like to turn it back over to the mayor and the manager and see if there's any questions.
All right, everyone, questions for Marilyn? Allison?
Hi there. Thank you, Thank you, Marilyn. What a great presentation. I think I may have just seen my question, and it involves the sewer consumption charge. I do see where that's incrementally going up. But so you've got one slide that says the percentage of these rates changing, and then the next slide is the dollar amount. Is that right?
Yes.
Financial element rate increases, that's the percentage, and then you're giving it to us on the next slide in the consumer sort of rate. Is that right?
Yes, yes. The percentage is the percentage increase from the year before. And this slide shows the actual rates to be charged.
Gotcha. I think we really did a good job of cutting that service fee when we did. Like you noted, it's encouraging conservation as well. And then I guess as a side thing, and I might just put it in an email to the manager, is I'd be very interested to know how many people are staying in tier 1, tier 2, as opposed to the percentage of people that are really ranking up the big bills. But that's I'm just curious about it, and I'll put that in an email so I can learn a little bit more. But I'm looking forward to
at the average single family home.
Mm-hmm.
This is about 3,500 gallons. So I think the vast majority of gallons are charged at tier 1, but we'd be happy to follow up with the details to that for sure.
Right, and maybe just give us the gallon amount for tier 1 too, so we're seeing what kicks it in volume wise to the next one. But I'm looking forward to hearing what the others think about this.
Others?
I have one question.
Patrick?
Marilyn Hall, you also do the water conservation as well, correct?
Yes, sir.
Okay, you look familiar. Okay, I just got a question about the connection fees, how much they cost, and do you feel that our connection fees are comparable to other communities, and does raising it have the potential of hurting new business or development?
Yeah, our most recent adjustment to the connection fees, I believe, was back in 2017, might have been 16, but right around that time period, we didn't see any change in the number of new developments that tie on. The costs of new development tend to be absorbed by developers, and every community has these connection fees, and so it's not unusual, and it doesn't affect the competitiveness of Athens for new development much. I don't know that we've done exact studies on that, but looking at past increases in connection fees, we've not seen any effect.
Thank you.
I'll note briefly, Patrick, just on that theme of economic competitiveness. Part of what conservation has meant is that we've got ample availability. So if a new business thinks about coming to town, and they're going to require some volume of water, of course, the first question they're going to ask is, can you provide the volume we need? And because of the really significant efforts at conservation, particularly post the drought of 2007, 2008, you come to Athens and, we can provide you with both water and sewer capacity. I mean, we're using, Marilyn, you'd probably be better to kind of peg this, but, somewhere around half or maybe even less than half of our capacity right now on average. Is that about right, ballpark?
That is about right. I think we're at about 13 million gallons a day, and our water treatment plant is permitted up to being recorded. So saying don't quote me on this doesn't make much sense, but roughly 30 million gallons a day.
Thanks, Marilyn. Good question, Patrick. Carol?
Yeah, thank you, Marilyn, for this. This is for a new commissioner, this was very thorough, and I appreciate the foresight and the planning that goes into taking care of our water and sewer system. Just a little clarification for me here, and I think Commissioner Wright mentioned that if you could explain the tier 1, 2, and 3 when you send out information as a follow-up, that would be fine in terms of the gallons. On the screen before this one, I think you had what the average bill was, and I believe you were saying that included the trash as well. Was that?
No, it's water and sewer combined. It does not include solid waste.
This is just I'm not used to so many hours and meetings there. Okay, fine. Great. That's it. Pass it on to someone else.
Okay.
Other questions?
Mayor, I got one if I could.
Yeah, Tim.
And thank you, Marilyn, for this. You always do great work. I guess it's just more to colleagues on the commission here and the mayor. Like, I completely understand the logic of having these fees come back in so that we can be prepared for all these new improvement projects. But I guess my thinking is that it's likely that in the beginning of FY22, we're not going to be out of this pandemic, and we're not going to be on the economic footing, at least a lot of our residents, that we'd like them to be that quickly. And I know that this isn't like massive increases, but it does add up, which is exactly why we decided to give a cut last year. So I wonder if it might be better for us to try to have a smaller increase, if any, in FY22, and then move the larger increase and maybe spread it out further along. I just know that, again, it's not going to be the best for some of our constituents. It's definitely not going to look the best for us to all of a sudden have 6% increases on all these fees hit all of a sudden while most of our constituents are still struggling with the pandemic.
Well, let me offer that, part of it was the cuts in the customer service fee. And, it's a little bit of catch up, and you're right. What we can do is maybe take a look at what that might look like and offer that as perhaps a potential CDO if it balances. I will say I'm going to defer to staff on the ability to turn this around quickly. This seems like a very simple chart. It's a pretty, it's the mother of all spreadsheets, I have to say. But Marilyn, is it fair to say we could take a look at Commissioner Denson's request?
Yes, sir, it is. We can spread that increase over time. We'll have to postpone some capital projects probably, but we can certainly do that with our pro forma.
Okay. I would love to be able to see what that looks like. I appreciate that, Marilyn. And the last one I had, and this was on something we discussed before and that you brought up, that the customer service fee is it makes more sense for us to put a cut there because, again, a lot of the lower income residents use less water, so that cut can really benefit them. So it's a bit of a more equitable cut. And so I wonder if in the future we could look at, again, taking the cut and have those increases not be as drastic on the customer service fee, and instead spreading it out along the water rate tiers, which customers are going to be paying anyways. But again, we could actually, again, in an equitable way, have a higher increase now at tier 4, which we already do, to kind of have that one, grow larger than tier 1. Because again, people will still be paying it, but we will have those people who are using a lot more water paying a heftier amount of it, rather than the people who are being a little more sustainable minded and not using as much money. And oftentimes those people are also some of the lower income individuals.
Yeah. Yeah, cutting our fees last year by half has potential to reduce our revenue significantly if there's a drought. I will say that our customer service fees right now, I have a piece of paper in front of me that tells me that in Oconee County the customer service fee is $15.48. Ours is $4.40. Jackson County's is $12 for water and $20.88 for sewer. I'm not sure that it's really financially responsible for us to reduce our growth in that rate. It's already significantly lower than the communities around us, and it already provides benefit to equity issues in the county. But it's not really my decision. We make recommendations and you guys make decisions, so we could look at that, but we're already 3 times lower than Jackson County.
I hear you. I appreciate your feedback, and that's especially what you talk about on the situation. yeah, just something for us to keep in mind there. But I would like us to see have some alternatives though on the across the board increases for next year. Thank you.
Okay, we can do that.
Thanks, Tim.
If I might too, Mayor, that these are great. This is exactly the type of feedback we look for, and we can bring some alternatives. I know ultimately, we'll make a recommendation, and as usual, y'all can change it as you see fit. I think an important thing for folks that are watching today to understand is that, you might hear of things spoken of like the infrastructure crisis across America. And there are many communities that have not reinvested in their system over time. And it's just a hidden liability that's going to surprise the ratepayers one day. And there's already communities, particularly smaller ones, that are really struggling with that. And I think part of the good story here is because of the good planning that's done by staff and the input from the commission and the approval from the commission, that this is a community that's reinvesting in a $2 billion infrastructure so that we don't have crisis going forward. So there's a lot of numbers, tonight. I think Marilyn's done an excellent job, but know that all of this is tied to a very thoughtful renewal and replacement program for our 3 water reclamation facilities, our water treatment plant, the miles of sewer collection pipe, and the water distribution system. And that's no small thing.
And even some of our large neighbors, City of Atlanta and DeKalb County, deferred some of these upgrades for decades, and only in recent years have really begun to catch up, to the chagrin of current leadership in those places. Any other questions or thoughts before we move on?
Can I jump in, Mayor?
Yeah, go ahead.
Yeah, so thanks a lot for putting this together. I mean, hearing this presentation, it all makes a whole lot of sense to me. But kind of echoing Commissioner Denson, we're going to be coming out of COVID around about the time that this would hit. Probably still not out of the woods, even with the vaccines, never mind the economic recovery. So bearing that in mind, I'm kind of thinking, in addition to being interested in a way of spreading this out over time or pushing back that bigger leap by perhaps a year, just how we're going to give notice to the public. Like this work session to me, I think includes a lot of information that makes it seem fairly obvious and like a good idea. But I think there's only 9 people watching right now, which, kudos to the very dedicated 9 folks who are watching right now. But I'm just wondering if there's a way that maybe we could put together some kind of informational video. I know the Public Information Office and various members of staff have put together really good informational videos for things in the past that could just kind of lay out like why this is a wise investment. Maybe even using some of those stats about how our fees are actually lower than neighboring counties, because we so often get critiqued for being more expensive than neighboring counties for things. And maybe if there's a way, I think we have the opportunity to provide a little notice, these charts being included in once we've voted on whatever the tiering or whatever the calendar will be for this, including this in somebody's water bill. So people can kind of not be surprised year after year as the rate goes up, but just kind of know, okay, there's kind of this plan in place to anticipate. I feel like that would be a good service to the public. And I guess to that end, maybe a question here is, do you all already have in mind a plan for how to notify the public about this?
Typically, we put a notice of the rates in a bill insert beginning of the fiscal year, and in our water source newsletter. We could potentially do more, but that's typically what we do.
Okay, well, I mean, my take, and I'd love to hear my colleagues' thoughts on this, but if there's a way to not just mention the increase, but kind of lay out in chart form like you've done for us here, kind of what people can expect in the years ahead, I think that might be a great service for folks. And then, if there's some kind of complimentary video we could reference in that letter that's like, learn more at accgov.com/, that might go a long way for making it seem palatable for folks at a time when it's hard to imagine paying more for anything.
We are working on a summary pamphlet, but a video combined with a pamphlet would go well together. So
cool. And this was excellent. Thanks again. Excited about the quarry too. I feel like we should celebrate that more and more.
So true. It's enormous.
And I gave a lot. I know the public utility staff probably noted this acutely. I just mentioned renewal and replacement, but the projects within the capital and infrastructure elements are much more than that, up to and including the water reuse plan and the quarry as well. So, as well as some renewable energy, things of that nature that public utilities does is all in there.
All right. Any other thoughts or questions on this item? Marilyn, thanks a ton. This was really helpful.
Thank you.
A good night. All right, Blaine, want to introduce Clayton Street?
Yes, thank you. There were a number of questions y'all have had in monitoring the downtown improvements that are part of the 2011 SPLOST and the 2017 TSPLOST, 2018 TSPLOST. And some of those that you had asked to us to loop back on before things are finalized include restrooms downtown, the eco stations, which is a way to, in an orderly way, take care of trash and recycling downtown, the public art component of that. So tonight we were going to talk to you about the public restrooms and the eco stations. Our solid waste director, Suki Janssen, has been dealing with some illness, and so she's not here tonight. We'll push that to February. We'll also have updates on I'll be sending out an update on the project in general. So tonight we're going to hear from Andrew Saunders on options for a public restroom, and would appreciate your feedback. Thank you, Andrew.
Good evening. One important point of business is you'll probably notice I am not Beth Smith with Facilities Management. Beth's worked very hard on this project and prepared this for you, but unfortunately a few items came up and her attention is needed elsewhere. So you're going to have to live with me. So what I intend to do tonight is take you through a little bit of history about the idea of a public restroom in downtown Athens. I would really like to hear some early feedback from you all on the location that's proposed and on the different setups that are available. And you can see here the topics that we'll go through. When we look at history, the genesis of this has its foundations in the Downtown Health and Safety Study, which was completed in 2016. That study identified a need for publicly accessible restrooms. There's really several reasons for that need. One is the buildings are older when we look at the businesses that are there, and so they tend to be under restroomed anyhow. They would not be the amount of restrooms that are needed in modern code. The second is we do have a population of individuals downtown that have difficulty accessing public restrooms. And then the third is that we routinely have public events downtown. I mean, it is our public square. And so on this map to the right, you'll see those three common public event areas. So around City Hall, down near the Arch and College Avenue, and then Lower Washington Street. It's where we see a lot of events and protests and community activities. So in 2018, a working group came together. You can see those partners listed here. It was a collection of Athens-Clarke County staff and the Athens Downtown Development Authority. And this was preliminary planning on where might a restroom go. A little later that year, Clayton started with the underground utility work that we're also familiar with. And then even later into the 2018, an engineer was engaged to look at some feasibility for public restrooms in downtown using that information that was provided by the working group. So ultimately, two locations were shortlisted. The first is the old bus ticket booth on Washington Street. This is on the City Hall campus. You see a picture of it here on your lower left. This would be a stick-built or built-in-place facility, so you would have to take it from the ground up. I would like to point out that it wouldn't just be within those glass partitions you see back there. The majority of that would have to be demolished out, and the building would extend closer to the photographer in this picture. And so there's some advantages. Most notably, there's some current utility service in the area, and it could hold more restrooms. An alternate location that was considered is over on College Avenue, near the College Avenue parking deck. Right now, that space holds downtown parking, the smoker's den, and the police substation. In this case, it would be a combination of use of that red loading unloading zone that you see on the picture to the right and some of that landscape island. The advantage to this is that it would be a smaller footprint. It's about a half a block more centralized. One important note is that in a non-pandemic environment, City Hall is open during weekdays for public restroom use, and it most certainly does incur that level of use. And so we're kind of trying to split the difference between those community gathering spaces that were shown on the previous slide. If a restroom were to be built in the second location, we would recommend some prefabricated units, and we'll dive into those in a little bit. Ultimately, the working group favors the location on the right, the College Avenue location. And one of the reasons why that is favored is because the location on your left, the old ticket booth, has kind of continually been talked about as this has a higher and better use. Might be a community cafe or a gathering spot, or it would be part of a broader City Hall campus that includes the Costa building, the mural, the park, and of course, City Hall itself. So with that in mind, we looked at two concepts for College Avenue. These are the two restrooms that we'd look at. The first one is from a company called Romtech. Ultimately, this restroom has two seats, two holes, if you will. It is built very durably. You can see the approximate cost here. It would be placed into the unloading zone to create more of a space. I'm going to use my cursor over here on the screen. If you can see it, we would have more of a space to queue. Another important feature is that we recommend that the hand washing be on the exterior of the building. There are a couple of reasons for that. One is in our engagement with other communities that have these kinds of restrooms, it is a recommended best practice. It cuts down on less desirable behavior that might happen in a restroom. The second is very simple, which is queuing. If you think about an Athfest or a game day where restroom utilization is very high, if people are conducting part of their business outside of the building, you can turn more bodies in that facility itself. So capital cost is a little over $360,000, and the operating cost is approximately $34,000. Concept number two is a concept from a company called Portland Loo. So this restroom that you see in the picture above was designed in partnership with the city of Portland, specifically to address their public restroom problems. So this one has been put through its paces. It includes such things like solar lighting to cut down on the need to have a utility connection. It also has a different approach to the louvers, so that there's a little more ability. There's still privacy, but there's the ability to kind of know if people are establishing themselves inside, and it has a smaller footprint. You can see again on this schematic to the right that instead of being parallel to the street, we recommend that it would be perpendicular. The door would swing open towards the parking deck itself, and we've identified the potential to actually use some of this space for a combination of enhanced landscaping and even perhaps a landing area for game day portable toilets, because even if we place a restroom here, we will not fully be able to service that game day style need, and so there will be 6 to 8 times a year where portables will still appear in our community, and this will just be a complement to them. You'll see that the capital and operating cost is a bit lower. Ultimately, it is staff's recommendation that you consider this unit. If you were inclined to move towards 2 units, we would actually suggest we spread them out over the downtown area. So side to side, you can see the fundamental difference between the two, aside from cost, is the RomTech unit has double the capacity at one location, whereas the Portland is a bit more efficient to operate and is, in our opinion, more likely to be durable. Beth has actually been in contact with cities that operate the Portland unit, and she's actually found as well some research about communities that have been utilizing them. And we found that it makes people into believers. They tend to be planning on their next one after they have their first. So really, at this point, what I'd like to hear from you all is if you are comfortable with the path that staff has started down. So as looking at those 2 locations, does the College Avenue location make sense over the Washington Street location? And if so, does a single-seater from this Portland Loo company meet your design guidelines, as well as the RomTech, the 2-seater? And then also, what are your expectations for public input? So there was some public input with the downtown health and safety study. And so what we want to be careful about here is we definitely want to hear from the public. And I think one real key constituency here is the businesses themselves who are currently subject to serving in this restroom role. But I don't want to cast the net wide enough to where it is, if we know that we've shortlisted locations, we wouldn't want to be disingenuous and ask people, where should we put a restroom? We might ask, what locations do you use downtown? Where do you gather? And then take that into information. And oops, that is not good because I just killed my screen. Another idea that we have is we could do a concept mock-up of one of these. So we could actually kind of frame out how large it would be and how it would sit in the street and kind of lay out where landscaping might be so that people get a sense of scale and the visual layout. And then, of course, we could do more of a traditional method of actually engaging with, in person, patrons in the downtown area. Once we get that feedback from you, next steps would be to, execute on your desires for public input, use that to make a final design revision, and then that would come forward to you as an agenda item where we would have contracts and construction. So with that, I will pause and answer any questions you might have.
All right. Thank you, Andrew. I appreciate it. All right.
Mr. Mayor.
Where does everybody like the idea of parking their rear in the downtown realm?
I had a question. Andrew, could you go back to that map of where you want to put them on College Avenue?
So this map is the kind of the gathering areas. The 2 locations would be one here, which is
the map you had right by the parking deck, where you had the Portland Loo sitting in the parking lot. That one. So when I first envisioned this thought, I was thinking we might put one of those right up against the building, sort of in that corner, right where the parking deck kind of meets the police substation. Did y'all think about that?
So we did. We actually tried to fit one in there. There is a piece of fire equipment that's needed that you need access for the parking deck itself. I believe it's a connection to a standpipe. And then you have to think about the access to the actual parking deck. So that exit comes out facing approximately north. And when you look at siting a restroom in there, we don't believe that spatially you can do that and maintain ADA access.
Okay. Well, thanks for looking into that. I think the Portland Loo is a good concept. I like where you put it there on College Avenue.
I think that's the place it should go. That's the place where I've heard business owners want it to go. As president of the Downtown Athens Business Association, we've talked about this for a long time. I'm ready to move forward on this one as quick as we can. That looks great. Good research, ready to go.
And Beth's done an excellent job.
Any other thoughts?
I have a couple thoughts.
Here, Mariah and.
Oh, I just wanted to chime in really quickly to agree with Russell about the location and the model. That's all the thoughts I have.
Others, Allison?
Yeah, I really like the research that's been done on this. I've had a lot of experience in the old country of Italy with the public facilities and the variety of those with children as well. My question is, are these free?
Yes, they are.
It's not a pay to go. Okay. And then is there a timer?
There is not.
There's not a timer. I do agree with this location. I think that this puts it at one of our facilities with the parking deck that doesn't have, right? There's no public restrooms in our parking deck, correct?
That's correct.
So I think it's a extremely logical location. I think the 2-seater is the way we should go. I think that we probably could really use about 5 of these downtown, but so that's why I think we should go with the double. The water outside is brilliant. Of that Romtech, and so I look forward to this moving forward as soon as possible. And I do like us saving the old bus depot thing for a better use. It could be restrooms in another form, sort of built in, but at this point, I think this idea is good here. 2-seater, the double octopus. What, you know what I'm saying?
The one that's on the screen right now.
The one that's on the screen right now.
Perfect.
We won't get into occupancy. I'm just there.
Others?
Yeah, I have a couple things.
Yeah, go ahead, Melissa.
Yeah, I'm totally good with the location and the Portland Loo suggestion. I would rather see us, maybe buy another one a couple years down the line and put it in a different place downtown to spread them out a little bit. Because I imagine we get late night customers in these, folks leaving the bars and stuff. I've read quite a bit about the Portland Loo, and I've read good things. It has this kind of like slightly open design that allows, people to kind of keep an eye on what's going on and making sure there's no illicit activity going on there. And that location right near the police station assures that there's some 24-hour presence nearby. I do like the outside, the other designs, wash station outside, mainly because it offers access to drinking water.
Well, let me clarify one thing, Commissioner. It's my understanding that we can get an outdoor sink with that stated budget on the Portland Loo.
Okay, good. And is that, I would love to see us have more access to water fountains or water bottle fillers downtown. I mean, as someone who always has my water bottle on me because I walk a lot, I feel like if we were, I feel like we kind of need some water fountains downtown. I don't know whatever happened to water fountains not being like a regular public amenity. I remember as a kid, they were always everywhere, and now you can never find them. Not just in Athens, but anywhere. So does that outside faucet allow for like drinking water access to fill?
I mean, it's a sink with potable water, so that is actually how I fill, 98% of my water bottles.
Yeah, good.
But it is not. What it is not is a water fountain.
I mean, most people these days seem to have bottles on them a lot.
Mm-hmm.
And there's one more thing. Oh yeah, public input. I would hope that there'd be at least a survey of downtown businesses to let them know that this is this concept we are considering. Any final input? I know that has been expressed that we really do need a public restroom downtown. I just want to think that these businesses should be made aware that this is the decision we're coming to.
Okay, thank you.
Any others?
Mayor, I have something just real
Can I-
quick.
oh.
Yeah, I'll jump on. I also prefer the Portland Loo, and I think the Washington Street deck is the better location. One thing, the Portland Loo, it just looks nicer. The other one looks like a tank. I honestly, you show it, I was like, I don't think I want to get inside that thing. Look at that. It looks terrible.
Yeah.
It's so cool. Oh, geez. So I like the Portland Loo, and then I've also read about this one too, and I know it's supposed to be like really easy to clean. That you can just take a jet spray water hose and basically all the water just comes out the sides, and it's really quick. And I also like the idea of us getting this and then possibly planning for a second one in a different location. The main thing I just wanted to bring up was on the public input, because Andrew, I think you bring up a good point. It's like I don't know if we want to like rehash an entire thing of do we want this, and then going back all through everything that the other survey already did. So I wonder, I like your idea of kind of throwing up a bit of a, I don't know, like a model of it kind of somewhere, and more of asking like, would you use this? I don't know. And just kind of like more implying it's going to be there and taking some more small suggestions, maybe on that green space and stuff like that, about how that could be changed. But kind of moving forward, like this is something we've already got baked in and we're going to have this here.
Yeah, if there's strong consensus about the location and the equipment, what I would offer is maybe some of that public engagement is more about the finer details. So for example, on this, we just have a block shown out here, but we haven't shown the curb alignment, we haven't shown landscape changes, we haven't shown hardscape changes. So we could have one mock-up that is kind of extends that pollinator garden down and doesn't have as much hardscape. We could have another that really is designed to be complementary of game day portables, and just kind of get some feedback from people about that, and put that into context. And then in those questions, I agree we could ask how people might use it, and then start to lay the framework of our additional restrooms. Should they be considered in the future, and if so, what parts of town should we look at? And maybe not even over time, it may be more than downtown, but certainly this is the focal point for the moment.
Yeah, awesome. Sounds like a great plan.
Can I jump in?
Yeah, go ahead, Jesse.
Very excited about these toilets. I love public restrooms. Glad to hear that they're free. Thank you for asking about that, Commissioner Wright. I second, I think, everybody who's spoken so far that this is the better location, in my opinion, as well. I'm excited for some of the things the ADDA has proposed for that old bus station. I am curious, the capital cost of this at $240,000, how much of that is modifying the site versus the facility itself?
So the majority of this expense is in the facility itself. I would say 60 to 70%, and we can get you those exact numbers if you'd like, Commissioner. We took the facility cost. Even if we go with a landscape heavy component, we're remodifying the curb, we're putting in landscape, we're plumbing up with utilities, and Public Utilities has graciously offered to support that. But at the end of the day, you got to buy the unit, and the unit's pretty expensive.
Okay. Well, seconding Commissioner Link, the idea of an outdoor sink on the small unit, hearing that that's possible, sounds very appealing to me, because that idea of being able to cycle people through more quickly sounds great. If there's an outdoor sink on it, does that also mean that it retains the indoor one as well, and there's two, or would it be like a different model where people would... I guess I'm wondering if we have the outdoor sink where people can leave, but they're going to choose to stay inside with a sink inside, then maybe it isn't worth the extra money.
My understanding is that the Portland Loo does not come with a sink inside, and so the sink is an upgrade and it's built outside.
Oh, okay.
With the RomTech, there are configurations with sinks inside or outside, but not both.
Okay, well, I think where I lean is the Portland Loo with a sink added to the outside, and my main reason for that is I do believe that we should be a sex-positive community, but I don't think we need to provide spaces for people to engage in personal activities in public restrooms, and I have been to all too many RomTech-style public restrooms where that has occurred. So I think the design of this is a lot better for that.
Yeah.
And I am curious. The reason why I asked about the capital cost is I know you had said if we added a second, staff's recommendation is to probably put it at a different location. But if there's a need downtown for probably more than one bathroom, if we might be able to jumpstart and save a bit of money on the front end to get 2 side by side in that location, if space allows, and then save a bit of the money that it would cost to prep a whole additional location.
So that is actually something that we talked about as staff. The SPLOST office had put that on the table for us to consider, which is if you look at the concept on the lower right, one of those concepts we can consider would be an expansion point. If you're going to lay concrete, you can go ahead and lay the sewer and water connections that might be needed if you wanted to drop in a second one. Mm-hmm. I will offer that, in my opinion, the Portland Loo is a bit awkward when you take them in combination with multiple units. And so there's a couple of reasons. One is my understanding the sink is only on one side. So you kind of lose the ability to funnel people into that a common sink area. Then also you have those forward swinging doors with some maintenance access in the back. And so we actually had thought about trying to even spec 2 out of the gate, and ultimately felt like 1 was a better starting point. But that was a really long way of saying we could absolutely put it into a concept. What I would recommend is we do the hardscape and have it set for a second one, and then put the first one into use and see what the demand looks like.
That makes sense to me. Yeah.
Good question.
Andrew, I'm going to speak up here. Carol here. As someone who's always looking for a bathroom, I'm really happy for these. And I like the way the Portland Loo one looks. And I am actually looking at the website now where it does say that they don't have the hand washing on the inside. But I wanted to bring up the point about the water on the outside, because it seems to tie in with a discussion I had a couple of weeks ago. And I don't know how this will, how this affects it all. But that I talked to 2 young men who are involved with 2 different organizations that work with the homeless. And when I learned a term the other day, the houseless homeless. So people who are living on the streets primarily, not in someone else's house temporarily or their cars. And they were telling me that one of the biggest needs for the homeless is water. And I was wondering how these would function. I mean, when we do find out information about those add-on water units, how are there different styles? Do we want that to be available to as many people as can be? Are they places where you could put a plastic bottle underneath it to get it, like Melissa was talking about filling up your water bottle? Or is it a very short period of little water that you have to just sort of wet your hands? And so I would be interested in finding more about that or discussing that aspect.
We can certainly explore it more. I worry, so when you think about trying to make this a multi-purpose tool where it is access to restrooms and access to water beyond the incidental water bottle or hand washing, you run into a couple of items. So for one, if you don't time limit the sinks, you run the risk that they will back up and just flow. And so there's the potential for significant water waste. An easy alternative to that is to put in a hose bib, but you can run into similar activities. So hose bibs are actually problematic on public property for similar reason. So what I would like is to spend some time with our team and see what is recommended. It really might be that the best solution is to have a sink here as kind of water access light and continue to have this body chew on better ways to just get fundamental access to water.
And I'm assuming these are easy to clean, obviously with this design, but that there's some water source that's being built in close by so that whoever's doing the maintenance of these will have that. That's part of the setup.
That is correct. And the operating cost that you see down there assumes a twice-a-day visit for somebody to attend to cleaning and to restock paper products and handle trash and that kind of thing. It also assumes for some operations and repairs. I would anticipate that it'll need deeper cleanings. You're not just going to come in and spray some Lysol twice a day. There's going to be times where this is going to take a good pressure washing or deeper clean to get it done. And then another factor just to put on your radar is, so if you all move forward with a public restroom, we will be needing to submit an operating budget impact for whichever restroom you pick.
Thank
you. All right. Appreciate everybody's input on this. And anyone else? Andrew, I agree with everyone. Don't want to belabor the point. I mean, I think this location and this model, I actually find the Portland Loo kind of elegant almost, especially compared to the sort of behemoth that is the other one. And for what it's worth, our resident commission expert in restrooms, Commissioner Hamby, had to depart, and he said that the Portland Loo in this spot is what he would like to see us do too. And I think in terms of the public input component, probably asking, is this a thing that would be or could be replicated, might be a relevant question. To do too much of a performance art piece might be like a episode of Portlandia. So anyhow, go forth and do well.
Thank you.
I do want to caution this body that all the accusations of us becoming Portland are going to be only truer if we get the Portland Loo downtown.
Yes.
Okay. So our last presentation for the night is Hayley Banerjee with Housing and Community Development, our director. And this regards the Community Development Block Grant, or CDBG-CV for COVID, a special allocation that we got last year from HUD. And this is to award those funds for community relief. And she's going to walk you through the process and the work with the Vision Committee and the recommendations. I did alert y'all, you'd indicated a real desire to get this out as quick as possible. You'll see the process. This went through with the regular CDBG applications in December, and Hayley and the Vision Committee have done a hurry up to try and get that to you with the objective of getting the contracts executed by February 1st. I say all that to say, after tonight, it would require your action on Thursday evening when a special call meeting is called to vote on that, and that would allow the contract work to go the latter half of this month and the next 2 weeks, really. So Hayley, I hope I didn't steal too much thunder. I'll turn it over to you.
Thank you, Blaine. Good evening, everyone. I know you've had a long night, so I hope I can keep us moving. If you'll bear with me as I share my screen. All right. Can everyone see that?
Yep.
Thank you. This is my first virtual work session, so thank you. So tonight I will talk about our CDBG-CV funding recommendations. So these are separate from our regular CDBG recommendations. You'll see me again in February when we go over our regular allocation recommendations, as we do every February. But tonight we'll review consolidated plan goals to refresh your memories, explain CDBG-CV application review process, review the CDBG-CV proposals and funding recommendations, and review the remaining schedule. So just as a refresher, again, HUD's consolidated plan. We are required to submit a consolidated plan to HUD that informs them how we plan to spend our CDBG funding. So that's a requirement from HUD and requires them to approve any funding that we actually undertake in the community. And these are our 6 consolidated plan goals. We presented these back in July of 2019, so they should look familiar for those of you who are on the commission. So number 1 is affordable housing development and redevelopment. Economic development and workforce development is number 2. Then education and enrichment, homeless services, special populations, and public infrastructure. And as another requirement for HUD funding, and particularly CDBG funding, we are required to incorporate citizen participation into our consolidated plan and any of our funding recommendations. And a key piece of that citizen participation is our Vision Committee, which is our citizen advisory committee for our CDBG funding recommendations. And we have our Vision Committee members who are currently serving here. So one key change that we made this year, which those of you who are familiar with our process, you'll notice you're used to seeing Vision Committee recommendations proposed with a yes or no based on what the body recommended as a group. This year, we actually asked them to prioritize their funding recommendations because you'll often see with so many valuable projects that are on the table, we want to say yes to all of them. So this gives us, I think, a little bit more nuanced view of what those priorities are in tandem with our staff recommendations. So you'll see that when we go over our funding recommendations shortly. Some CDBG-CV funding history. We were notified that we would receive an initial allocation of CDBG-CV funding totaling $829,000 in April, but we did not receive guidance from HUD on how we were allowed to spend those funds until August. And I will share that we are constantly receiving updates from HUD as they are figuring out what's eligible and what's not. So we've been working with those constraints and making sure that we have the best information possible to remain in compliance with those newer funds. So on September 15th, we were notified of an additional allocation of $893,000 in CDBG-CV funding. And on October 15th, we advertised the availability of that first allocation of CDBG-CV funding. We held a virtual meeting, which was attended by the public. We released our CDBG-CV application and our regular CDBG application. You can see there's a number of different milestones that we've reached that you've been a part of, including when HUD notified us of a change in our proposed allocations for regular CDBG and home funding that required a notice of proposed administrative action. And the resubmission of our consolidated plan. And all of that, the most important piece here is that for the second allocation of CDBG-CV funding, we have not yet advertised that funding, and that has yet to be done, and we will need to do that before we can program those funds for community use. And we'll talk about those in a couple slides. So this is our currently available CDBG-CV funding, again, that $829,000 roughly. And our pending consolidated plan that we have submitted to HUD includes our usual 20% administration cap of $165,000. We're finalizing those administration cost estimates, and any remaining funds that are left will be reprogrammed into direct services. And the public services funding number that we're working with now is $663,000. And we received 14 CDBG-CV applications that requested approximately $1.4 million in direct community services. And for our potential use of second CDBG-CV allocation, again, this is for $893,000 that we've not yet incorporated into our consolidated plan, and we'll need to advertise that in order to fund any programs with this amount of money. What HCD is proposing, which I know is of interest to you all, and we've talked about this on a number of occasions at this point, is using these funds to address long-term homeless support needs. Our total allocation, again, is $893,000. A portion of that we are recommending be used to create a new homeless specialist position to coordinate our homeless response internally as we go through numerous responses to encampments through whether it's code enforcement, central services, the police department, solid waste. Currently, there's no point person as we try and implement a uniform policy to respond in a compassionate way. And I don't know if you all are aware of this, but we don't currently have a position within HCD that is solely focused on homelessness in our Continuum of Care Homeless Assistance Grant funding. So currently, we have 2 positions that split their time between CDBG Public Services activities and our homeless assistance grants, and providing technical assistance to the Homeless Coalition and homeless providers, doing the reporting related to our homeless management information system, it makes it very difficult for us to be proactive and strategic and moving forward to address ending homelessness. So we are proposing the creation of this position to address some of those long-term and more strategic needs. And the other portion of what we're recommending, and those funding needs, around $715,000, we are recommending that be used for some long-term homeless supports related to a housing first method that supports permanent supportive housing. We've talked a lot about unsheltered homelessness this past year in particular, and particularly with COVID, it is incredibly clear that housing is healthcare, that you cannot shelter in place if you don't have access to housing. And one way that we can attack this issue is by allowing a nonprofit the ability to create additional permanent supportive housing opportunities. One barrier we constantly face is working with landlords and trying to get clients who may have barriers related to their eviction history, criminal history. Allowing clients to actually qualify for a lease is very difficult a lot of the time. And one way we can get around this is if the nonprofit is actually operating that kind of a facility. So that's what we're recommending. We're excited about the opportunity to take some long-term and immediate action with these funds. But that would, of course, be pending your approval, and I look forward to hearing your feedback.
Thanks for that, Hayley. I appreciate. Oh,
yeah, a few more slides, and then I'll be done. And this is just a list of CDBG-CV eligible activities. When we released our CV application, we listed rental and mortgage assistance activities and homeless assistance activities as our priority areas. But all public services activities are eligible as long as that activity prevents, prepares for, or responds to coronavirus. That's the big eligibility piece that HUD has tied to these funds. And similarly, our ineligible activities, again, the big piece is if it's not related to coronavirus, then it's not eligible. And of course, with federal funding, there's a whole lot of nuance there as well and strings tied to it. But here are our CDBG-CV funding recommendations. And again, you can see the Vision Committee's priority rankings 1 through 14. So staff and the Vision Committee are recommending funding for 4 agencies, all providing financial assistance. Their top priority was Habitat for Humanity and their financial assistance program, and $80,000 is recommended for them. Our second activity that's being recommended is Casa de Amistad's financial assistance program, and $215,000 roughly is being approved or recommended for them. Our third Vision Committee priority was Athens Land Trust financial assistance program, which we're recommending $267,000 for. And then the fourth program we're recommending funding for is the ARC's financial assistance program, and recommending $100,000 there. And just to note, all 4 of these agencies have a long track record of carrying out CDBG-CV funds. All 4 of these agencies carried out financial assistance programs successfully with CARES Act funding in the fall. So they have a very, very strong track record. The Vision Committee felt very strongly that financial assistance was the top priority for this funding, and felt very comfortable and very strongly about funding these 4 agencies. So I know there's probably some questions there, and I'll come back to that screen, but our next steps and schedule, as Blaine mentioned, we've got the special called session on January 14th. We plan to initiate contracting as soon as we get the go-ahead on those funding recommendations the next day, and then contracts executed on February 1st. So, any questions or comments?
I've got one, Hayley. First of all, thanks. This is really great to hear, especially about using potentially that second round of CDBG-CV funding for kind of pushing ahead our housing first hopes and dreams. I have been, in close contact with folks who work directly with the homeless, just on a personal basis, giving out hot meals, making sure people have hand warmers and stuff like that. And they'll be really delighted to know we're moving ahead on that. With regards to the current round of funding, I was wondering how it was decided that funding would go only to the top 4 in the ranking rather than spreading the funding out, perhaps, offering a lower level of funding for each organization, but giving more money to a more diverse array, since they do serve different communities and might have different populations that they're able to target. So yeah, I'd just love to hear more about why they chose to have funding concentrated among those top 4
Sure.
organizations, which I also agree do great work.
Sure, and it's a tough process. I mean, it's a pain every single year to get so many valuable applications from well-known agencies that we know are doing good work. And really, I would say the biggest component in making these decisions, both as staff and vision committee, was the scale that the agencies were able to provide. And I don't have the numbers in front of me, and it may have been included, I think, in the summary recommendations that were included in the work session materials. But the number of proposed households served for each of these agencies was taken into account. So you're looking at larger numbers of proposed households being served by these 4 agencies than some of these other applications. So I would say, coupled with what we've seen as the dire need for financial assistance that's ongoing, as well as the number of households that can be served by those agencies, those were the big 2 determining factors in limiting it instead of spreading it out in lower levels of funding for more agencies.
Got it. Thank you.
You're welcome.
Thanks, Mariah. Others?
I have a question, Kelly.
Yeah, Vita.
Commissioner Thornton. I think these are all very worthy groups to service, and I'm wondering if anybody is talking about anything more physical. Were there applications around physical spots for homelessness? Everything here seems to be, and I have 2 questions. Were there any applications that talked about actual physical sites or shelter for homelessness? That's my first question.
So literal homeless shelter applications for CV funding. No. And I was surprised we didn't receive more for that, specifically like hotel shelter and those kinds of activities. I suspect some agencies know that we've got remaining resiliency package and indigent services funding. And we're continuing to try to be proactive in assessing those needs there and knowing what we can fund with those indigent services funds does include physical homeless sheltering. So there's another potential funding stream there that's a little harder to support financial assistance with than CDBG-CV funding is. So, but yes, I was surprised that there were not other physical hotel shelter applications there too.
And not just physical with hotel sheltering, but also, makeshift temporary sheltering options. So there was nothing, because everything here seems to kind of, I don't know, it's nothing, it's nothing that talks about putting roofs on people's heads, especially for those homeless campsites. So that is very bothersome, and maybe that's something that CDBG does not fund, but that is bothersome for me. When we give food away and people really don't have a place to prepare food, or it doesn't seem like we are really getting to the root of the problem. And definitely, I don't see on here any kind of healthcare, since this was through the COVID. I don't see any kind of healthcare or anybody requesting funding for healthcare, as far as testing, vaccine. Well, we didn't know about the vaccine back then, but that is bothersome to me. I don't think that we are. So I don't know if these things were not. I see healthcare with East Athens Development Corporation. What is healthcare? What was that about?
That included some COVID testing and some public awareness campaigning related to like public health and COVID concerns. And I think, not to take us too far off track from the CDBG-CV funding, but as staff, when we're looking at these CV funding recommendations, we're trying to look holistically and thinking about any remaining indigent services funds, any potential funding we hope to see from the federal government. We're trying to think proactively about where we can match funds best. And I can share with you that I've been in conversation with the attorney's office about ways that we can use, again, that indigent services funding to support some of those healthcare needs and supporting our indigent population there. Because again, we know, like you said, we didn't know about the vaccine back when we advertised this application, but certainly we want to do everything we can to make sure that we're getting resources to some of our indigent healthcare providers to make sure we're getting as many people vaccinated as possible. So I hope to be back with a work session or an agenda item related to that sooner rather than later.
I am very excited to see the Sparrow's Nest on here. How did we get around the religious situation that we faced in the past?
So for CDBG or federal funds in general, as I understand from the attorney's office, we don't run into the same issue with the establishment clause, the state's establishment clause. But for indigent services funding, I think that would be a barrier still in funding Sparrow's Nest or another sectarian organization.
And Commissioner Thornton said another way, all the barriers that we ran into with the resiliency package funding using local funds, those are not present when using the federal funds.
And I do appreciate the list of agencies that are recommended for funding. I would like to see the list of applicants that did not receive funding.
They're all listed on here on this table. The ones in bold and the ones with funding recommended in this last column, those are the ones that we've recommended for funding those 4 agencies. So all 14 applicants are included on this table.
These are the 14 then?
Yes, that's correct.
I got you. Okay, thank you.
You're welcome.
Thanks, Avita. Others? Hayley, I really appreciate the work that all these agencies put together in these applications, and thanks to you and staff for working overtime this year. Obviously, the normal cycle that we've all gotten used to has been layered with lots of new work, and reflecting some of the earlier comments. Excuse me, I'm particularly interested in ensuring, I think, like Avita just kind of reference, that we do invest in some permanent housing opportunity. So I've been a big supporter of that, and also trying to beat the bushes and find out what other kind of funds may be able to be coupled with the second round of CDBG-CV dollars.
I had a comment if I could.
Yeah, go ahead, Tim.
Oh, thank you. Yeah, thanks for being here, Hayley, and putting this together for us. And first, just want to say, super excited about the homeless specialty position. It's obviously something we needed for quite a while, and it's going to be a perfect way for somebody to be able to work with all those other homeless service providers and shelters and stuff like Commissioner Thornton brought up. So I think that is a good use of those funds there. And I completely support all 4 of these. I think there is some valid points about that. This is all kind of financial assistance in the same realm, which is obviously completely needed, and something I've been advocating for. But kind of like what the mayor just said, I guess we just really need to make sure that we're pursuing other programs, other funds that we can be plugging in other places. And especially I'm hoping that we can get, I know I've talked to a lot of y'all about it, and with you, Hayley, about getting a eviction avoidance program in place like Gwinnett and Clayton has now, that kind of gets people right when they're at the brink of that actual homelessness. Like this thing goes through, they are out of their homes, kind of people at the most extreme end of it. So I'm hoping that we can definitely use some of that future funding that we're going to find to do programs like that, but also the healthcare aspect too. But appreciate this and super excited about that homeless specialist. So thank you.
Thank you.
Oh, could I chime in with one last thing, Mayor Girtz?
Yeah.
I'm also very, very excited about the homeless specialist position. I would like to urge us to try to hire, I guess you could say, in-house with that, in the sense of like there's a lot of people in our community that already do really good work directly with the homeless, just out of the goodness of their hearts, who have close relationships with folks living in encampments, are aware of the specific needs of individuals in our community. And so I would love for us to leverage some of that expertise that those folks have gained through months of relationship building in that position, if at all possible. So just wanted to make that note in closing.
Thank you.
Any last takers?
A question has arisen in my mind.
Go ahead, Jesse.
Yeah, I feel like I chimed in everywhere else, and this is actually probably the agenda item I was most excited about. So thanks for sticking with us here, Hayley. I am curious if you have a sense, all these organizations have been doing work up to this point, and if there's going to be a gap in funding, do we have a sense of what's going to happen as members of the community might have built up a relationship with a given organization who's going to lose the funding availability to provide a service, and the ripple effects that might have on the amounts requested by the organizations who we are able to allocate funds to at this time?
Sure. And it's always a concern. And I think this is, I guess, my first experience in this terms of like a global kind of economic crisis since I've been in the working world. And I think what's been really important for us and for me is to keep in close contact with the other funders in the community. So like Sarah McKinney at the Athens Area Community Foundation, or United Way, even Creature Comforts, like as we've got these other more private funding sources, trying to plant seeds or have discussions very candidly about here's what we can do with our funds here are the barriers we're seeing, here's when this funding ends, what can we do about this gap that we're seeing. And of course, the resources aren't there to meet the need just because the need is so great right now. But we try our best to be proactive in that way and work together as funders in the agencies to try and prevent those gaps as much as possible. But it is a concern and can hurt trust between individuals accessing resources and those agencies. So we're very aware of that.
I do want to add something here, and just for people to for commissioners and mayor to put this on their minds. I'm happy about a homeless coordinator, but after meeting with Shay Post last week, and I've talked to Evan Mills, I don't know. It seems that there is there's a gap. I know we have the homeless coalition, but and knowing the work that the Sparrow's Nest does, I think there are enough people out here that are doing this work frontline every day. And they are not having the resources to do the work even more effectively. So I'm not as thrilled about bringing on another body. I am concerned that we are not supporting people that are already doing this work in the community. So I'm not as thrilled about that, but I do support the agencies that got money. I would have liked to see more money that people who are directly working with homeless people to get funded, and that's not the case here with this list. So I'm not as thrilled as everybody else at this point. And I don't know whether that directive came from HUD or our interpretation of HUD, but I'm not as thrilled as everybody else about another person. We just hired another part-time person to work with the homeless coordination. And so we don't need no coordination. We need people who are on the ground working every day with these folk and I'm not as thrilled, but I do appreciate these groups, and maybe the money could have been allocated, been split up a little bit more or directed more. I think Commissioner Parker kind of addressed early on, maybe not, but I do want to go on record that there are people out here that's doing this work every day, and they are not getting our support with homelessness.
Mayor, and if I might, I'm sorry, Commissioner Link. Just let me explain this to Commissioner, to all y'all. So I had asked Hayley to go ahead and telegraph some of the thinking with the second tranche of funding, so that as you made these decisions, you had some, understanding of kind of where staff were suggesting things are headed. This is, of course, up to y'all. And the mayor and I have talked about, the 4 priorities that y'all have articulated, through your retreats, as far as homeless and affordable housing, workforce development, public safety, youth development. We really want to go through a process of deconstructing some of those big sticky issues to find out where it is you really want to make some impacts, to Commissioner Thornton's points. So it was a little bit premature, to get there tonight, but I was the one that asked, let's go ahead and put it all on the table so that y'all understand, because there's so many different pots of funding and different time cycles, so we just wanted you to have the benefit of that. So Commissioner Thornton, there's more to come and an opportunity to give further feedback on that.
And thinking about kind of this collection of comments, one thing that may be beneficial when we return with the second round of CDBG-CV fund discussion is just at least a brief sketch of the homeless support ecosystem. So, everybody has a sense of what organizations are doing what work and kind of where that gap analysis has led us. Melissa.
Yeah, I'm good with this new position that's being created. I mean, I know HCD was kind of whittled down years ago, in the wake of the financial collapse, and hasn't really come back up to full staff yet. So, and being that homelessness is a major need in our community, and it's something that needs to be tackled from multiple angles, I totally see how having a staff person in the Athens government fully dedicated to that can begin to tackle those issues. We've all discussed different ideas on how to tackle the problem, and this person could be the one to kind of organize those ideas and present us with solutions. I see. But my question is about the agencies that. Well, first of all, we awarded those COVID funds, those CARES funds back in to a fairly long list of agencies, and then there was a little bit of extra money awarded last month to a handful of agencies. I'm wondering if those agencies ever got that last bit of money to carry them over into this year. I've heard things that they've had to kind of float it themselves, and those funds haven't actually come through yet. Can someone speak to that?
Sure. And I think Blaine may have sent an email earlier this evening with some explanation there too. But to recap, Casa de Amistad and the ARC are on track to get their funds this week, and Land Trust will likely receive theirs next week. We sent out and had to rewrite the contract with the attorney's office because it was not CARES Act funding, so we needed different contract language that the attorney's office was comfortable with. But I believe we sent out the contract template on December 22nd. But for those of you who are not so lucky to be well acquainted with the contracting process at this point, it's an intensive process. It requires back and forth between HCD and the agency, and then we have to collaborate internally with our safety and risk division, with our attorney's office, with finance. So we basically worked a miracle back in December when we awarded those additional $75,000. And I guess I should clarify too, are you asking about the $75,000 extra that was awarded in CARES Act funding, or these January funds, those two separate pieces?
I guess I'm asking about both. I want to make sure that these agencies are getting the funding that they've been awarded, and I have questions about why it's taken so long. I mean, from what I understand, some of these agencies have had to kind of float the difference, and some of them are not really capable of that.
Sure. And the $75,000 extra in CARES Act funding was awarded and paid to the agencies within the week that you all approved it. I believe that was the week of December 7th, maybe. The January funding is the piece that's taken longer because of the new contract and those requirements. But those are the funds that will be available this week for 2 of those agencies and next week for Land Trust.
Okay, thank you.
You're welcome.
I want to go on. I would like to suggest that we look at how other cities are managing homelessness as far as staffing is concerned. That is similar to this to the population of Athens-Clarke. Again, we have 2 coordinators on staff, and how are other cities that are similar in population dealing with this problem of homelessness? Because you can have a room full of folk working and still no work is, and we still don't get to the work. So maybe we need to look at what other cities are doing as far as administration and staffing, and maybe they're worse than we are. Maybe they're not doing a good job. But I know that there's some folk on this list and some folk who are not on this list that are on the front lines doing this work, bleeding blood, sweat, and tears, trying to do this work, and they need the money to get it done, and not, just a body to say what should be done. So maybe we need to look how other cities are managing homelessness that is similar in population and staffing, and as far as the department.
Sure. Thank you. And this is a conversation we've been having internally as a department for years, at least since I've been a part of the department, and within the division that balances between both the public services CDBG activities and continuum of care funds. And it's not uncommon in other jurisdictions to see whole divisions in a department that are solely focused on that public service community development block grant work, and then a whole division that's focused on that continuum of care homeless assistance grant homeless activities work, because it's very different, and they're very different compliance requirements. They're 2 different federal grants. It's actually a rarity from what I've seen that we have 2 folks in our department that actually split their time between both of those grants. But we'll continue to look at other jurisdictions and how they're set up as well, as we propose that in the budget process.
All right, everyone, the hour is late. I have $1 burning a hole in my pocket that I think Little Italy is looking forward to getting. Any final thoughts?
Thank you.
All right, everybody, please be safe.
Thank you.
We'll see you Thursday evening.
Thanks, y'all.